Good. I'm probably louder than this on my own, which is just strange. Good morning, everybody. Thank you so much for being here. How many of, just raise your hands real quickly, how many people are here for the first time to our Caregiver Coalition conference? Everybody? Almost? Wow. Great work, marketing and distribution team. Thank you so much for being here. My name is Brett. I am the chairman of this ragtag amazing organization. And I just want to thank everybody for coming. Did everybody have any problems getting here today? Everyone was good? Awesome. So, a couple things. I need a, where's my thingy? Sorry. Presentation remote. Let's see. Okay. Let's see if this works. Oh. All right, now we can get started. I have a lot of energy, naturally, and I did have 1.5 iced coffees this morning already. My day started earlier than yours. It started at 5 o'clock this morning. I gave my dog a bath at 5 o'clock this morning, which was adorable. So I've had a lot of time to get that energy going. So I apologize in advance for that, but I really appreciate you. So just a couple of things for you. Standard housekeeping, just to kind of get you prepared for the conference today. Just please make sure that you silence your cell phones. Keep in mind that this presentation is also being filmed and live for our viewers at home and online. So we just trying to make sure we're controlling the sound a little bit. If you need to take a telephone call or something like that, you've got the hallway in the front here. And then there's also 2 rooms in the back that you can take that in. So I'm just letting you know. Also in the back there, who has to use the bathroom sometimes? People? I'm diabetic, so I pee all the time. Honestly, and if they made the whole diapers thing look cooler with like more, it's sad because my nephews actually have like Marvel pull-ups. If they did that for adults, I'd consider it. But anyway, if you have to use the bathrooms are actually in the back room there with the other vendors in the back there. So the men's restroom is on this side closer to us, and then you kind of have to go around the corner for the women's restroom. But if you need it, it's there, and they're amazing. They're very clean. Those bathrooms are bigger than my first apartment. I know, right? It's amazing. So please take advantage of them. Obviously, take your time to speak with the vendors while they're here today. And on top of that, you'll see people. We're an amazing group of resources and the volunteers as well. So as you're listening to these presentations and talking to the vendors, if you have questions about anything that you need help with, please ask somebody before you leave, because it's not just the presentations that you're going through and learning about today as resources. We want to make sure that at least we talk to you and we can either find out what you need and get back to you with whatever you need help with, or send you home with resources. That's why you have those wonderful bags with you. We'll stuff stuff in there and make sure you need. Okay? That's probably because I'm moving around a little bit. Is that better? All right, I'm not going to move. I'm going to stand just like this close to the microphone. And other than that, we do have water back there for you on the back table. So if you get thirsty throughout the conference, we will be refilling them. So we kept them nice and cold for you as well. So thanks, everybody. Thanks, BA, who donated the water bottles for you today. So honestly, I just want you to be comfortable. And if you need something, just ask somebody. We've got volunteers everywhere, and we care a lot. We're incredibly sweet and kind and overly passionate people. So take advantage of us while you're here. So I thought I would give you a little breakdown. I put this in your registration emails just to kind of give you expectations of what we're going to be doing today. So right now, we're obviously me doing welcome and introductions. So we've made it that far. The first speaker, Jim Johnson, is going to start at about 11:15. And then you'll go to lunch at 12 and have more opportunities to talk with the vendors, ask questions. And then we'll have our second speaker, Autumn, start at around 11:45. And then at 2 o'clock, you'll have some time to talk to vendors again. And also, remember this, you're all going home with a 30-pound bag of vegetables. I know San Antonio Food Bank was amazing, so let's thank the San Antonio Food Bank because they're also not here to. Easy, don't worry about it. We've got volunteers. Plus, you know, we need our workout over the weekend, which is what we did yesterday, getting them here, which is awesome. So just know that every one of you will go home with vegetables. So thank you, San Antonio Food Bank. All right. Another thing, too, I always want to thank our sponsors. You'll hear more from them again, but we have UT Caring for the Caregiver as our title sponsor. They made this event happen. Health Texas, thank Health Texas for having us here. Oh my gosh, no, I can't thank them enough. Their staff have been amazing. Their table's right over there. They provide incredible medical care as well, and I just can't thank them enough for being amazing. We also have Salsa, which is successfully aging and living in San Antonio. How many of you like to eat? Okay, so you should thank Salsa because they fed you today. How awesome is that? Yes, so thank you. And obviously the San Antonio Food Bank, I wish they were really here. They couldn't send somebody. They were busy this weekend, which is awesome. But yes, lots of great vegetables. The Alzheimer's Association, their tables in the back. VA Caregiver Support gave you your water. We have the WellMed Charitable Foundation, the Village of Incarnate Word. I do want to thank Oats and Senior Planet because they are streaming this for us today. So thank you for that. And we have the Texas Grandparents Raising Grandchildren Program, Gray Matters, and Adroit Medical and Promise Senior Solutions, Texas Health. Please stand by. Hello? Is that okay? Can you hear me now? Oh, thank God, that was awesome. I have too much energy to stand there. It's not going to work. I got to move around. Okay, so the Alamo Caregiver Support Coalition, we are a subcommittee of the Bear and Alamo Senior Advisory Councils under ACOG. We are the community advisement board for the services that they provide older adults in the community. We are a large organization of over 60 other organizations that are all on this committee. So we try to tell ACOG what they need to do for the community and how to spend the money that they get from the government and grants and other things. But more importantly, we get all of the other organizations together to fill in those gaps so that we all work together. And we have too much fun doing that, as you can tell. And unfortunately, they have to put up with me leading these meetings. But that's exactly what we do. Our meetings are open to the public. So if you ever want to come to one, we meet on the third Tuesday of the month from 8:30 to 10, and we meet at various locations because we're constantly trying to learn about new organizations and the services that they provide the community so that we can give those resources to you. So please join our Facebook page, which is Alamo Caregiver Support. You can find us. It's a private group, so you can just send us a request for that. But please come to our meetings if you're an organization. If you want to show up yourself, all of these organizations are there. You can ask us questions at our own meetings. And if you have questions about maybe services that aren't being provided in your community and you want to find out why, maybe we can help you with that as well. And so really, that's who we are. And honestly, apart from that, I do want to talk to you a little bit about ACOG. Well, actually, I don't want to do that because I'm overly passionate about this, and I do the coalition. But we have Emily Ortiz here from ACOG, and she's going to talk to you a little bit about the services that you might need. Emily, come on up here.
Thanks, Brett. Thank you. Good morning, everybody. My name is Emily Ortiz. I am the Community Outreach Specialist for the Alamo Area Council of Government. And just like Brett, I like to move around. How's everybody doing this morning? Ooh, y'all are awake. Y'all must have had some great coffee. So we cover 13 counties. I personally have traveled from Dilley down in in Frio County, I'm sorry, to go all the way up to Fredericksburg. If you ever want to do that, that's about a 2.5-hour drive. So we cover quite a bit of ground. So let me talk to you about our front door, the Alamo Service Connection, or the ASC, or you may also hear me refer it as the ADRC, short for Aging Disability Resource Center. We like to call this our front door, and this is the way to get in and connected. So if you're 60 and older and you're seeking services, we're here to navigate those public benefits, such as Medicare. Who knows how to handle Medicare? Because I certainly don't. We help out with utility assistance. How many of y'all have looked at your CPS bills and just been, my goodness? We help out with grab bar installation. Sometimes we're unsteady, and I know it only gets worse as we age. We help out with navigating Medicare again, and that includes parts B, C, and D. We're not affiliated with any particular insurance. Our job is to make sure you're aware of what's available to you and to advise you on what may work best for you. At the end of the day, the decision on which plan you pick is yours and yours alone. We provide in-home providers and caregiver support. How many of you are caring for somebody and you were just thrown into the role without any training or expectations? I see a lot of hands going up, and we're here to navigate that. We don't want our caregivers pouring tea from an empty pot, because if you're pouring tea from an empty pot, what are you really getting out? What is the person that you're caring for really receiving? And we help out with a lot of community resources. So let me go into our caregiver services. How many of you are familiar with respite? All right, respite is that much needed break. So going back to pouring tea from an empty pot, respite is that opportunity that we want all of our caregivers to take to rest, recharge. And that can look like maybe going to the grocery store, taking a nap, going to an appointment for yourself. Oftentimes we see our caregivers go without those appointments. Caregiver and education training, like many of us, myself included, when I was caring for a few loved ones, I didn't know how to transfer them. I didn't know how to get my mom out of bed. I didn't know how to move my grandma safely. We want to make sure that you're caring for your loved one safely. We don't want you to get hurt, and we don't want them to get hurt with an accidental transfer accident. So we're here to educate you on what tips and proper techniques you can take to protect yourself and your loved one while providing that adequate support. Residential repair. How many times have you gone somewhere, or maybe you've bought a house and not thought about, I'm going to need a ramp in a few years? We don't think about a few years ahead. We think about what we need now. But a few years down the line, maybe you do need a ramp. Maybe you have that first step that's too big to go into your doorway. We can help out with ramps. We can help out with grab bars, because we want you to be stable and safe, and we want you to be able to care for somebody safely. Income support, going back to CPS and their rates. You know, we see it often. We open up our bills, my eyes almost pop out every time I look at my bill myself. So we can help with that supplementation and emergency response systems. How many times have you heard, you need Life Alert? We're here and we provide that emergency response, whether it's an pendant or a bracelet. And mental health counseling. A lot of times we see our caregivers so stressed out that their mental health is causing effects on their physical health. There are support groups out there, and we want to make sure that you as a caregiver are being taken care of and taking care of yourself. Because if you are not taking care of yourself, how are you going to take care of your loved one? And our health maintenance. How many times is our loved one going without dental checkups or eye checkups because insurance and money issues? It's more often than we'd all like to admit. So these services are here to support your loved one. And this is open to anybody 60 and older, or anybody aged 18 and older taking care of their loved one that is 60 or older or has dementia. Oh, Brett, I did something. Try this again. Bear with me through this. Okay, I'll stop right here for my spiel. So in order to get a hold of us, again, I want you to reach out to the Alamo Service Connection or our ADRC. You can reach them at this handy-dandy 210 number, 210-477-3275, or if you're outside of Bexar County, 1-855-93-72372. Now, before I leave the stage, I want to introduce a gentleman to you. After 30 years of working with the Federal Reserve Bank of Kansas City, he retired as a vice president with responsibility for supervising and regulating state member banks and bank holding companies in the 7th State 10th Federal Reserve District. After moving to San Antonio, he volunteered as a state health insurance program benefits counselor with ACOG from 2006 to 2021. He has been a member of the Bear Senior Advisory Committee since 2012, serving as the chair in 2016 and 2017, and as chair and a member of various subcommittees during his tenure. I'd like to present to you Mr. Jim Johnson.
Okay. I won't talk to you about banking today. I'll try to talk a little bit about Medicare. You probably look at the first slide, and some of you might say, well, he doesn't even know how to spell his last name, but it is spelled without an H, Jonson. I have no idea what the total, or didn't know what the total experience was going to be here today in terms of people, so I'm not going to start with the very beginning, but let's at least take a quick look at the 4 parts of Medicare as the basics. A, B, C, D, that's what it is. Parts A and B are what they call original Medicare, because this is what started back in 1965 when LBJ flew to Independence, Missouri, where I actually lived for a while, and he went to the Truman Library and he signed the Medicare bill into law, gave the first card to Harry Truman and his wife, the second one to his wife, Beth. Then we have Part C, and this came about during the Clinton administration when the Balanced Budget Act was signed in 1997, and what it did was it actually provided to private insurance companies the right to step in and take over some of the Medicare benefits. They still had to follow what Medicare proposed, but they could do it as a private insurance company. They called that Medicare Plus Choice at the time, but then in 2003, during the George W. Bush administration, they signed what was called the Medicare Modernization Act, which created Part D. Prior to that time, there was no prescription drug coverage. And it also changed the name of these private plans to Medicare Advantage plans. And so we have A, B, C, and D. Well, did they leave the right clicker? Maybe it's this one. Original Medicare is a federal government-administered program, and it covers inpatient hospital care, medically necessary doctor visits, outpatient services, and some preventive care. Most beneficiaries do not pay a Part A premium, as many of you probably know. As long as you worked 10 years and paid the Medicare, or paid the tax for 10 years, then you're entitled to no payment. Also, if you are married and your spouse worked at least 10 years, you have at least 40 credits, as they call them, and you don't have to pay anything for Part A. So it is free for most. But also with original Medicare, there is some cost sharing. There is a Part B premium, which is $185 this year, and for what it's worth, the estimate is it's going to go up to about $206 next year. And there's a 20% coinsurance after you meet your Part B deductible. And that Part B deductible is $257 this year, and that's probably going to go up next year too to something, maybe, I don't know, 280, 288, something like that, maybe higher. These are just estimates. Also, with original Medicare, there is no out-of-pocket limit. If that's all you have, then there's no cap on things, and you could pay thousands, 10,000s, or whatever dollars if you don't end up with something to supplement this. There's a provider choice. You can see any doctor or hospital that accepts Medicare anywhere in the United States when you have original Medicare. But you need to purchase a separate prescription drug plan, Part D, in order to cover prescriptions. And you can buy a Medigap policy to help cover these deductibles and the co-insurance. Now, that $185 premium that's up there that's going to go up, that's what it is for most. About 7 or 8 or maybe 9% of the beneficiaries in this day and age pay more than that because of IRMA, which is the Income-Related Medicare Adjustment Act. And you can pay 140% of the base premium. Some people that make over $500,000 a year are going to end up paying $550 a month for Part B. So the pros to original Medicare is you have provider flexibility, you have network access across the United States. You can go to any doctor across the United States or hospital that accepts Medicare. As far as cons, there is no out-of-pocket annual cost limit, and you do have to buy a separate drug plan. Medicare Advantage is a Medicare-approved alternative to original Medicare. It's offered by the private insurance companies, like we say, that have contracts with the Medicare program. They're bundled plans. They'll wrap up Parts A and Part B that we looked at into this, and normally 97% of them are going to have Part D coverage all in one plan. There's some extra benefits, as you see with the TV ads and so forth, like many of them are going to provide dental, vision, hearing, gym memberships, and so forth. It's basically basic, although some of them have gone up a little more. Like the dental, oftentimes it's simply maybe 2 visits a year, 1 cleaning. But there are some extra benefits that are there. Some of them even will pay part of your Part B premium. And some of them will provide some other things, even food delivery and things like that you may see, but you have to be qualified. When you see that, that doesn't mean that you can just get it and have food delivered unless you're really low income or have some means of having that necessity. There is cost sharing. When you have Medicare Advantage, you may pay a monthly premium in addition to the Part B premium. You're going to have co-pays, you're going to have deductibles, and there's co-insurance there. One thing about the Medicare Advantage plans nationwide, there is an out-of-pocket limit. They have an annual limit on how much you'll pay for covered services. And this year that limit is a max of $9,350. Some of them may have a limit of $4,500. Some of them may have a limit of $5,200. When you hit that limit for that calendar year, you don't pay anything more out of your pocket. You roll over to January, it starts all over again the next year. That $9,350, everything else we talk about is going up. That's actually going to drop to about $9,100 next year. Exactly why, I haven't figured out yet. Provider network. Most of the plans will have a network of doctors and providers that you must use in order to avoid paying more for non-emergency care. Emergency, most of them anymore will pay for that. Referrals. Some plans may require referrals before you can go see specialists. In other words, you may have to go to your primary care physician and say, gotta go see a specialist. There are some that do not. There are 2 types, and we'll talk about those, of Medicare Advantage plans, primarily HMOs, health maintenance organizations, and PPOs, preferred provider organizations. You normally have more freedom with the preferred provider organization, but you may end up paying more for that plan. The pros for Medicare Advantage, without the supplemental or separate prescription premiums, the cost may be less, and you do not have and does not have an out-of-pocket limit. The cons, limited provider networks, potential for higher costs for out-of-care network, and it may require prior authorization for certain activities. Well, a quick look at Part A. And these are things that have to be covered by both Original and Medicare Advantage, because the law says that the Medicare Advantage plans have to cover basically what Original Medicare covers, only they can do it in different ways. But they all cover inpatient hospital care. If you're admitted to the hospital, it'll pay for a semi-private room. Either you or friends may know people that get in and they have a private room. Well, if one's available, they'll do that. But the basic guideline says pay for a semi-private room. Skilled nursing facility, Part A covers for that. Not long-term care, not nursing homes, but skilled nursing facility. If you've been in a hospital for at least 3 days and your doctor says you need to go somewhere for occupational therapy or physical therapy or something like that, even certain wound care that needs to be healed in a different way, then skilled nursing facility is covered by Part A. Home health services that a doctor determines are medically necessary, and all Part A, both Original Medicare and Advantage plans, will pay for hospice care. Now, with Original Medicare only, there is a Part A deductible. If all you have is Original Medicare, then there is a $1,676 deductible when you're admitted to the hospital. Not emergency room, but if you're admitted to the hospital, you pay $1,676 for each benefit period after you're admitted. If your benefit period stay extends beyond 60 days, then there are actually co-pays. And you pay $419 a day for days 61 through 90, and $838 a day for 91 through 150. And that 91 through 150 is actually a lifetime benefit offered only one time. Now, benefit period means it's 60 days. So if you were to go in the hospital on January the 1st and you come back out on February the 1st and you go back in before February, the end of February, you're still in the same benefit and that deductible wouldn't start all over. But if you were to go in on January the 1st and come out on February the 1st and not go back in until July, then you're in a different benefit period again. The skilled nursing facility, you pay nothing for days 1 through 20, but you would pay $209.50 a day copay for days 21 through 100. And all these numbers change every year, and they go up, they never go down. Well, for both Original and Medicare Advantage, what does Part B cover? It covers outpatient care, doctor visits, that's what we normally think of, hospital emergency room, home health services, durable medical equipment like wheelchairs and walkers and things like that, laboratory tests, rehab services, palliative care, including hospice, of course, and other medical services are covered by Part B. And those are also covered by Medicare Advantage plans. They're just covered in a different way, and we'll see an example later on. Well, with Original Medicare only, you do have a Part B deductible. It's $257 this year, as we pointed out earlier. So basically, the first time you go to a doctor in the middle of the year, let's say it's a $307 visit to make it easy, you're going to pay $257, and then you're also going to pay 80% of that additional $50 that's on there. And so once you do that, the next time you go to the doctor, if you have no other insurance, you're basically going to pay 80% each time, or 20% each time, and Medicare will pay the 80%. Preventive services, there are some things, particularly like tests that you can take, PSA tests for men, women examinations, certain types of shots that you go to the pharmacy and get flu shots, and the COVID shot, we hope you still can, and other things like that where you don't pay anything. It's 100% paid by Part B. And you can get a pneumonia shot once every 10 years. So preventive services and certain screenings and so forth are covered by Part B with no deductible. Well, in order to cover the gaps that we've talked about with Original Medicare, you may consider buying a Medicare supplement policy. These are sold by private insurance companies. Many of them are the same companies that sell Medicare Advantage plans, United Healthcare, Aetna, Cigna, so forth and so on. But also with Medicare supplement plans, you'll find them sold by State Farm Insurance and some other insurance companies that don't get involved with Medicare Advantage plans. They're known as Medicare Supplement Insurance. They're also known as Medigap. Something you need to buy when you're first eligible. So if you're on original Medicare, you're thinking about going to original Medicare, this is something you need to pay attention to. In 37 of the states, they follow the Medicare guideline, which says that you only have a 6-month trial, a 6-month time period where you can buy a Medicare supplement plan and be guaranteed that you can buy it and not pay more than somebody else would. And that period begins when you're 65 years old or older and enrolled in Medicare Part B. As some of you may know, if when you turn 65, if you're eligible for Medicare, you want to take Part A. If you're still working and you have insurance through an employer, you can postpone Part B because you don't need it. You want A because even a policy that an employer may have is going to have some deductibles. If you go to the hospital and you have a Part A, you'll pick up those deductibles in most cases. But the period in which to buy a Medicare supplement plan begins when you have A and B. Even if you wait till you're 68 or 69 and retire, lose your employer insurance and you sign up for Part B, then you've got A and B, you've got a 6-month time period where you can buy a Medigap plan without being subject to underwriting. I mean, regardless of your health, you'll get it and you will not pay more than any other 65-year-old or 67-year-old if that's when you get Part B and you decide to get one. After that, you're subject to medical underwriting. Now, that's 37 states, you know. Some of them are more liberal. There are some states, New York as an example, where you can buy one anytime and you're not subject to underwriting. You can switch anytime you want. You know, well, you're subject to underwriting, but you can buy one. You can't be denied. But you'll find that if a Medicare supplement plan here is $100 for a woman, as an example, that same plan in New York when you turn 65 is probably going to be $250 or $300. Now, there is an instance of a trial right. When you first go on Medicare, if you decide you want to try Medicare Advantage plan, you can get that Medicare Advantage plan. Then you have a 12-month time period. And this is only when you're 65, if you sign up and you have A and B. If you're 67 or 68, you've been working, you retire, and then you get your B, you don't have this trial right. But if you're 65 years old and you go on Medicare when you're first eligible during the 8-month time period, you have to sign up, or the 7-month time period, then you can go for up to 12 months and decide to drop that Medicare Advantage plan, go to original Medicare, and then you still have a right to buy a Medigap, guaranteed right. But that's the only instance where you can do that. Otherwise, you've got only the 6-month time period. Well, when we're looking at the Medicare supplement plans, and if I said Medicare Advantage, or I was talking about Medicare supplement, I'm sorry. The Medicare supplement plans, they come in all kinds of letters, A, B, there's a plan C, there's a plan F, so forth and so on. But the two most popular ones today are G and N. And this sort of shows the things that are covered, and I kind of overlaid inside so that it would relate back to what we've already talked about. Medicare Part A, co-insurance and hospital cost. If you have a Plan G or Plan N, then that pays for that. That's the $619 a day cost we mentioned and the $837 a day cost. We had to pick it up and pay for it. The 20% that Part B doesn't cover, when you have a Medigap, it will pay for that 100%. Pays for the blood for the first 3 pints. If you can't get the blood for free, if you have to pay for it, this will pay for the first 3 pints. Normally, you don't have to pay for it. It pays for Part A hospice care co-insurance. If you have to go to the skilled nursing facility, if you recall, you are in there for free for the first 20 days. After that, there was a $209 a day cost. If you have one of these plans, it will pay for that. Also, the Part A deductible that we mentioned, the $1,676, the Plan G and the Plan N will pay for that. They won't pay for the Part B deductible. Plan F pays for Part B deductible, but the only way you can buy a Plan F anymore, Plan F does everything that G does except it pays that deductible. but you can only buy that if you were born before 1955. Part of the reason that the government, Medicare, decided to stop that was because they found that people that had Plan F, and I had one originally but decided to change, when they had a Plan F, they would go to the doctor more often, go to the hospital more often. It's only a joke in a sense, but I think they used the phrase that people with hangnails would decide to go to the hospital. And so it was causing the companies to pay more money, Medicare to pay more money, so they dropped it so you can only buy one now if you were born before 1955. One of the things I point out, and then you see the Plan N, the plan's a little cheaper. I can't tell you exactly, but in Texas, I mean, there's a lot of companies that sell Medicaps. Normally what you're going to find, maybe on average, when you're 65 years old, a female that would buy a Plan G would probably pay about $100 a month. A man would pay about $115 a month. Males pay normally about 13% more for each level, at least this year. And then, of course, the price goes up every year, at least every year once. One of the things I highlighted at the bottom, I put that on there myself, because a lot of people talk about, well, what plan do you have? And I don't want that one because I don't think they're a good company, et cetera, et cetera. Medigap plans make no decisions at all. When you go to the doctor, you may have to present your Medicare card and your Medigap card. They want to see that because they want to know how they're going to be paid and whether you owe something right there at the desk when you leave. But Medicare insurance plans do not make any decisions. When you go to the doctor, they'll send that bill to Medicare. Medicare looks at it. If they think it's medically necessary, they'll pay for it. They send it on to the Medigap, Medicare supplement plan, and they'll pay the balance. But they do not make any decisions. The Plan N, which is quite popular, which, you know, maybe instead of $100, you might be able to get one for $83 or $84. It's becoming very popular, but it's very much like G, except you may have a copayment of up to $20 when you go to a doctor's office and up to $50 for emergency room that you have to pay out of your pocket. But it is becoming very popular. Plan G is the most popular plan now. N's moving into second place pretty quick. Plan F used to be, but it's dropping out because new people can't get on Plan F unless they were born before 1955. Now, you may not need a Medigap plan in some instances. If you have TRICARE for life, as an example, retired military, that serves as your supplement. You have to have A and B, though, to use TRICARE for life. If you have TRS retirement insurance, you may have their insurance, which is a Medicare Advantage plan, but it's better than most of the Medicare Advantage plans you can buy on your own. If you're a federal retiree and you have FEHB coverage, you may not need parts A, and sometimes you may not get B, but it's wise to have B because as you get older, you'll find there's some deductibles there, even when you go to the doctor with the government plans that you may have to pay out of your pocket. If you have some other former employer retiree insurance that will cover Medicare deductibles and co-pays, and of course, if you're on full Medicaid or if you have a Medicare savings plan, you're a qualified Medicare beneficiary, you know, then you don't have to have one. In fact, if you're on full Medicare or Medicaid, an insurance company cannot sell you a Medigap policy. And I point out once again at the bottom, regardless of what kind of retiree health insurance you have, if you qualify for free Part A, you want to take it. You want to take it when you're 65. What about Medicare Advantage plans? It's the alternative to the original Medicare insurance program. It's offered and administered by the federal government. It's offered by private insurance companies. Medicare Advantage plans have to be approved by Medicare to provide and administer benefits for their members. They also have to be, insurance companies that sell the Medigaps or anything else have to be approved by the state insurance department to operate in that state as well. The Medicare Advantage plans cover the same services as Part A and Part B, and in most cases, 97% of the time, prescription drugs are included. There's more predictable co-payments, deductible amounts than what you have with the original Medicare without a Medicare supplement plans. and additional coverage may be offered for dental, vision, hearing, and other services. How popular are Medicare Advantage plans? Well, take a look. 2007, 19% of Medicare beneficiaries had Medicare Advantage plans. Today, 54% last year, and I wouldn't be surprised if it's 60% or getting right up to 60%. People were going that way because it's less expensive. In most cases, it's less expensive. Not always, but at least the premium cost and everything going in is less expensive. So it's becoming more popular. Unlike Medigap plans, Medicare Advantage plans are guaranteed coverage. The issuer cannot at any time deny you coverage or charge you higher premiums based on health history or pre-existing conditions. Contrasting back to the Medigap plans we talked about, you've got that 6-month guaranteed time period, perhaps 1 year. If you start with a Medicare Advantage plan, you have 12 months maybe to get a Medigap if you switch back. After that, like I said, you're subject to underwriting. They can charge you a higher premium with a Medigap plan because of your health, or they can simply deny you totally. And if you've got cancer, if you have real cardiac problems, cardiovascular situations, and so forth, you're going to have a very difficult time getting a Medigap once you get past that 6-month period. But you always have that 6 months after you get Part B where they can't charge you any more than anybody else and they can't deny you. But with Medicare Advantage plans, you're always eligible regardless of your health. So you'll find that Medicare Advantage beneficiaries probably switch plans more frequently than original Medicare beneficiaries will switch plans. You contract with a Medicare Advantage plan for the calendar year. So once you're in it, you cannot drop or switch plans during the calendar year, except since 2021, they've also created this Medicare Advantage open enrollment period. So from January the 1st to March 31st, you can switch plans. Open enrollment every year is from October 15th through December 7th, when you can change Medicare Advantage plans, and you can also enroll in a new prescription drug plan, Part D, for the next year. But with Medicare Advantage, you also have this extra time period from January 1st to March 31st, where you can switch Medicare Advantage plans, or if you already have one, you could drop it and go back to original Medicare. Now, keep in mind, too, though, with Medicare Advantage plans, some providers may choose to leave or may be dropped during the calendar year. Very seldom is that going to happen. I mean, you can also have a provider that just decides during the middle of the year to not take Medicare at all, although most of them will wait till the end of the year. And true, with Medicare Advantage plans, they may do that too. But you may sign up with a Medicare Advantage plan because your doctor accepts it. There's always a possibility they could leave during the middle of the year, but it's not very likely to happen. So, comparing original Medicare to Medicare Advantage. Provider restrictions? None. With original Medicare, you can go to any doctor in the country who accepts Medicare. With a Medicare Advantage plan, there are a network of providers, and if you are allowed to go out of that network, you'll pay more. And that comes into the HMO and the PPO, which we'll look at. HMO, health maintenance organizations, there's a network of doctors, and you have to stay within that network. If you don't use a doctor in that network, be it a specialist or a primary, you'll pay whatever that doctor charges. With preferred provider organizations, you also have a network, and it's cheaper to stay in that network, but you do have the option to go out of the network, and part of it will be covered. So going out of the network doesn't cost you as much with a PPO as it would with an HMO. Also with original Medicare prior authorizations, uncommon, only 1 in 100 Medicare recipients needed some kind of prior authorization in 2023. Some of you may have read, but under the current administration, there is beginning this next year a trial with even original Medicare where they're going to require prior approval on some things, but they're kind of rather fancy things that most people don't get involved with, some kind of services, some kind of treatments. With Medicare Advantage, prior authorization is much more common. 2 per person were required in 2023. Why? Well, Medicare Advantage plans are private insurance companies. They're in that to make money. And you just think of how they might do that. What happens is every year Medicare will look at each county in the country, they'll look at their fee-for-service results, which means their original Medicare results. How much did they pay in Bexar County out of their pocket for people that had original Medicare in 2024? And they'll look at that, and they'll divide it by the number of people, and let's say it comes out a nice $14,400. I mean, some people they'll pay $200 for the whole year, $300 for the year. Some people that pay tens, twenties, hundreds of $1,000s. But it comes out to $14,400. So what they say then is divided by 12, that's $1,200 a month. So they tell all of the Medicare Advantage plans, you want to sell your plan or your plans in Bexar County, we, Medicare, will give you $1,200 a month for each person you sign up for a plan in this county. So it's a business. So they want to make money. So naturally, with Medicare Advantage plans, you're going to find that there'll be a little more restrictive, they'll ask more questions, and they may end up denying some things. But the truth is, and I have to be honest on this, even though the denial rate to start with, or the postponement rate is 13% higher, I think, with Medicare Advantage, most of the time, if people appeal that, then the Medicare Advantage plan will end up paying it. So the bottom line is denials with the Medicare Advantage plans are really only 1 or 2% more than original Medicare. The negative part of it, if you want to look at it, is simply the fact that you have to wait and you might be delayed on things. The maximum out-of-pocket limit, original Medicare, you have none. Like we said, with Medicare Advantage, it's $93.50 in 2025. If you reach that during the year, you pay nothing else. U.S. travel. Original Medicare covers you wherever you go in the United States. You can use it anywhere. But with Medicare Advantage, typically it only covers you for your specific area, although there are some regional plans as well. But normally it's not going to pay you all over the place. So if you decide you're going to spend half the year here and half the year in Minnesota, a Medicare Advantage plan might be a problem. Emergency care, though, even with Medicare Advantage, is covered anywhere in the country. Specialist referrals with original Medicare, not required, but it may be required from your primary care physician with Medicare Advantage. Premiums this year with original Medicare, you pay $185 for Part B, usually $0 for Part A. What you find with Medicare Advantage, you still pay that $185 for Part B, and the plan premiums are usually $0 or very low. In this part of in Texas, for the most part, you'll find an awful lot of $0 premiums for both PPOs and HMOs. You go to other parts of the country, particularly back east, you may find them more with premiums. But I point that out because there are people that sometimes say, I'm going to go with a Medicare Advantage plan because I won't have to pay Part B. Well, you do. Everybody has to pay Part B if you're on Medicare, so you're going to pay that anyway. Copays and coinsurance, original Medicare, the deductibles and coinsurance, including 20% on Part B. And with your Medicare Advantage, it varies based on whether the care is in-network or out of. And I've got an example here in a minute of a couple plans that we'll look at. Compatibility with Medigap. With original Medicare, yes, you can buy a Medigap or a Medicare supplement. Not available with the Medicare Advantage plan. It's illegal for somebody to try to sell you a Medigap plan when you have Medicare Advantage, so it's not available. Doesn't mean you can't go buy a hospital indemnity plan, I guess, to pay what the plan may not pay for hospital stays, but basically Medigap is not available. Vision, hearing, and dental, of course, like we said, is covered under Medicare Advantage plans many times. 97% of them are going to cover it. Original Medicare doesn't. It's separate. Drug coverage, you have to sign up with original Medicare for a Part D plan, so that's an extra expense. Most of the Medicare Advantage plans cover prescriptions, but it's not flexible, meaning with original Medicare, you can change Medicare Part D plans every year, and I do that every year or every other year, it seems like. But with Medicare Advantage plans, the only way you can change a prescription drug plan is by changing the entire Medicare Advantage plan. But to be honest, sometimes with some of the Medicare Advantage plans, you see better prescription coverage than what you can buy with the separate Part D plans because they kind of design them themselves. They have to follow certain of the same rules, but they can sometimes be a little better. Open enrollment, once again, I pointed that out, but just to keep in mind, October 15th through December 7th each year is what we call open enrollment. That applies to Part C Medicare Advantage plans and Part D prescription drug plans. I'll get friends who will call me now and then and say, I've got a Medicare supplement and I want to try a Medigap, I want to change. Do I have to wait till the end of the year? Medigap plans, Medicare supplement plans, you can change or try to change anytime you want, January through December. But open enrollment applies to Part C and prescription drug plans, and like we said earlier, you've got that extra time in January where you can, to March 31st, where you can switch Medicare Advantage plans. Well, what about the HMO versus a PPO? Do I need a primary doctor? With an HMO, yes, you'll choose a primary doctor to manage all of your care, and he will refer you to specialists. It doesn't mean you might have a specialist that you like that knows has your same plan. You tell the doctor you want to go, he may let you go to that, not necessarily the one he wants, but you have to have approval from a primary care. With a PPO, you can go directly to any specialist or doctor that you prefer, in network or out of network. You can go to anyone. You don't have to go to a PCP in order to have them refer you to a specialist. You can do it on your own. Can I choose any doctor? Yes. With the PPO, you can. HMO, you have to stay within the plan's network except for emergencies. What will I pay? Usually, well, this is nationwide, usually with an HMO, lower monthly cost. That's true. Less out-of-pocket spending. But with a PPO, you might have higher monthly costs, but more choices for your doctors. But again, as I said, in this part of the country, you can find both PPOs and HMOs for zero premiums pretty easy. You need referrals in your HMO. You don't need a referral with your PPO. You can see specialists without it. Can I get care outside of the network with HMOs only in emergencies? Although emergency and urgent care coverage, you can have that throughout the U.S. if you need it. But with PPOs, you can go outside, but you'll pay more if you do. And you have emergency and urgent care coverage there as well. You look at the bottom left-hand corner, just for what it's worth, really in 2024, about 60% of Medicare Advantage beneficiaries were on HMOs. But again, part of that, I think, goes back east. You go back to New York, you go back to Connecticut, places like that. You'll find that more people there have Medicare Advantage plans and a higher proportion have HMOs. But all around the country, 60%. With few exceptions, like I said earlier, HMOs and PPOs in the counties that I've listed have no premium, but you still have to pay the Part B premium. And a few PPOs in these counties have premiums ranging from $18 to $142. Why did I put these up here? Simply to show that, as an example, in Bexar County, there are 30 HMOs this year. There are 27 PPOs. There are also 10 special needs plans. There are special needs plans that are developed for people that have diabetes problems, heart problems, cardiovascular, if they're dual eligible, if they're in a nursing home. They're primarily set up so that they make sure that the doctors are in those plans. There's a lot of them, and some good ones, I guess, that help these specific areas if you have problems in those areas. Bexar County, you see 30 HMOs, 27 PPOs. Gillespie, which is where Fredericksburg is, you have a lot of PPOs and HMOs. Kerr County, not as populated. You only have 4 HMOs, but you got 13 PPOs. Why so few HMOs? Because there are fewer doctors out there, and it's harder to get a group of them together, I guess, on one plan. Here's an example of an HMO and a PPO in Bexar County. I just picked Bexar Blue Cross Medicare Advantage and AARP PPO. These are just examples, just to show you how they work in contrast to original Medicare. No premium on either one. Out-of-pocket maximum of $47.50 on the Blue Cross HMO. With the Medicare Advantage, it's a PPO. The AARP, you got a $6,700 out-of-pocket limit. If you stay within the network, you go out of the network, you can go up to $10,100. You hit those levels, you don't pay anything for the rest of the year. Primary doctor, you see zero in both cases, but $25 out of network on the PPO. The specialist, $20 in network, 0 to 40, depending on who you go to, in network with the PPO, 75 otherwise. Come down to the hospital, here's where you can really get some cost involved. If you remember with original Medicare, you paid nothing for the first, we had a $1,676 payment, I'm sorry, but once you had a supplement or plan N, you'd end up paying nothing. But with an HMO, you'll pay $350 in this plan for the first 8 days and then nothing after that. With the PPO, it's a little higher. In fact, you see, if you go out of network with a PPO, you'd pay $595 a day for days 1 through 17. So the hospital cost can be more expensive. And like I say, you cannot have a Medicare supplement, but you perhaps could end up with an indemnity plan if you wanted. I don't think most people do that. Skilled nursing facility, you can see the difference here with the HMO. You pay nothing for days 1 through 20, and you pay $214 for 21 through 39, and then nothing after that. But you can bet yourself assured that that insurance company is going to do their best to get you out of there, and you're not going to stay there that long anyway. And then we see with the PPO, it's a little different price, and then some of the other things that you will pay. So let's take a situation as to how this would work. I haven't said at the beginning, but I'm not favoring either one of these. Some people will tell you that. Some people that have original Medicare, oh, I'd never do a Medicare Advantage plan because it's got to be the worst thing in the world. And you may talk to friends that do have that, but there are reasons that you might go to one way. There are reasons you might want to go the other way. But let's say you had a serious accident or a heart attack. You had an ambulance trip. You got your primary care doctor probably involved, specialist. You have surgery, several days in the hospital, medicine during the hospital stay. And when you're in the hospital, by the way, Part B pays for your medicine, and also the medicine would be covered, however it's covered under your Medicare Advantage plan as well. Skilled nursing facility might come into play because you may have physical therapy, follow-up specialist visits. I don't know. We'll just guess that the total bills presented for all this stuff is $280,000. And Medicare, and let's say the Medicare Advantage insurer, if that were the case, they both say, we'll pay $50,000. Because those of you that are on Medicare may know how that works. You know, I end up with skin cancer every now and then with a basal cell, and I think I had to chop a piece off my ear and stitches here for something not too long ago, the basal cell stuff and a squamous. And I think I looked at my Medicare bills, and with all the biopsies and with everything else, the total cost was like $14,000. And Medicare said, we'll approve $3,900. So, you know, that's why I did this kind of example. What they charge as such is never what the insurance company agrees to pay. Let's say that was the situation here. If you have original Medicare and a Plan G, as long as all the providers accepted Medicare, which is most likely, you'll probably have no out-of-pocket medical expenses except for your Part B deductible. Probably paid 100%. Medicare Advantage plan, I think there's little doubt that you will, for the calendar year, have out-of-pocket medical expenses. You know, you will have them of at least $4,750 with that example we had on the HMO, or $6,700 or $10,100 with the PPO, because if you go through all this stuff, you'll probably be using out-of-network doctors as well during your recovery or surgery somewhere along the line. So what does that mean? Well, what's your cost for the original Medicare? You got the premium of $185 for Part B, so that's $2,220 for the year. You got a Part D deductible, you paid $257 if you had a Plan G. Let's say you paid $150 a month for the Plan G, you got an $1,800 payment. You got a Part D premium maybe of $480, so $4,757. What do you have with the Medicare Advantage plan? Well, depending on whether you got the HMO or the PPO and you're out of whatever it is, you'll have more, like maybe $6,970 on the HMO, $8,970 on the PPO, $12,320 on the PPO. And keep in mind, at the end of the year, if this happened to happen and you're still recovering or going through some of this stuff, you roll over to January 1st, it starts all over. So you look at this and you'll say, well, it's probably better to have end up having the original Medicare and Part G. I won't say that. Number one, what you have to realize is that Part G premium particularly is going to go up every year. It may be $150 after a couple of years. I know people now with Plan Gs that are older that may be paying $350, $450 a month for that. Another thing to keep in mind is that all that's going to go up on the left, but on the Medicare Advantage plan, you know, hopefully you're not going to do this every year. Maybe it's just happened once every 10 years or once in your Medicare lifetime. So if that's the case, you know, even the $12,320 is there, but years going forward it may not be. Only about 2% of people with Medicare Advantage plans each year go over the maximum out-of-pocket limit. So in the long run, you could be better off on the right because hopefully you're not going to do this $12,000 every year, but everything on the left is going to go up. So there can be, you know, you got to balance it out. So it's not as bad as it looks like to start with. Well, which plan is right for you? Do you want the flexibility of original Medicare, or is the potential for lower upfront cost and extra benefits with Medicare Advantage more attractive? Do you have chronic conditions, or do you anticipate high medical costs? If so, maybe there's a reason to look at original Medicare. Can you afford a Medigap plan, the Medicare supplement, to supplement the original Medicare? Or would an out-of-pocket limit with a Medicare Advantage plan be more suitable for your budget? Do you want or feel you need to keep specific doctors and specialists who might be out of network with a Medicare Advantage plan? Because one of the things you want to do if you decide to go with a Medicare Advantage plan, find out if your doctors accept that plan. Some of them are limited. Some of them will accept most anything, even if they don't accept your plan to start with. There are some doctors that say, well, no, but I'll accept that if you want to do it, and I'll sign up. Do you travel frequently within the United States, and do you want to have medical coverage anywhere that Medicare is accepted? If that's the case, people that spend a half a year in one part of the country and a half a year somewhere else, original Medicare might be the better way to go. Also, I just threw this in here. Do you anticipate the Mayo Clinic or MD Anderson to be in your future? Because for what it's worth, Mayo Clinic doesn't accept Medicare Advantage plans anymore, except they have some kind of contract ongoing with United Healthcare, but they don't. MD Anderson, they accept some of them, but I read recently, for whatever reason, they have dropped Blue Cross Blue Shield of Texas. So these are things to think about with Medicare Advantage plans. The largest insurers, obviously, United Healthcare, Humana, Blue Cross Blue Shield, do about 61% of the work or of the business for Medicare Advantage plans. Average commissions, for what it's worth, for Medicare Advantage plans, those commissions are set by CMS, the Center for Medicare Services. And the commissions are paid, though, by the insurance companies, but the brokers who sell them can get $626 when they sign you up for a Medicare Advantage plan, and then each year it renews after that another $313. Medigap plans are set by the individual insurance companies. They're going to vary, but they said the average last year was, you know, like 20% of the premium. So if you got a premium of whatever that works out to, the $1,500, what's that, $125 a month, then, you know, the premium $125, so then they'll pay $300 and $312. So you can see that the commission is much higher with the Medicare Advantage plans. And again, I'm not against Medicare Advantage plans, but you think back to a couple of years ago with the Joe Namath and William Shatner, and you still see it on TV. All the advertisements are primarily for Medicare Advantage plans. They make more money with them. There are some major changes coming in 2026, particularly for Medicare Advantage plans. If you happen to have a United Healthcare plan, it's going to affect them most, but they are actually dropping companies this next year. In other words, they're going to quit. You'll be notified if you have one or you have friends that have one by at least the 1st of October, and it's going to tell you that plan is going away. And if it's going, and not all of them, there's just some of them. I think it's about 1 million people in the country, which is only about 3% of the people that have Medicare Advantage plans are going to be hit by this. But if that's the case, you have to pay attention, because you'll either have to switch. They're not going to cross you over like they sometimes do. When a plan quits, they'll cross you over to another one automatically if they don't hear from you. but they're going to drop you if you don't sign up for another Medicare Advantage plan or go to original Medicare. And that happens, you got to take care of it by the 1st of January. One of the things about it is that because of that, as I understand it, the people that are being dropped will have an opportunity to go to Medicare Advantage, Medicare, original Medicare, and buy a Medicare supplement, regardless of health, regardless of their condition. I do understand, though, that I think people will have to buy, they can't buy an N if this happens to them. You can buy a G. The only way you can buy an F is if you were born before 1955, but G is the best one, I think, anyway. The reason that is because G, you pay the $257 deductible, but you're going to find that the premium is more than $257 a year less for a G than it is for an F, so it's wiser to go with a G. I can give you an example of how you can do this. Some people get on original Medicare, and I've had friends that do this, and all of a sudden they're paying $400 a year because they're getting older and older. If you're healthy, you can switch, and I don't mind saying that I did. I've done 3 times. When I first went on Medicare 15 years ago, so I give you my age right there, didn't I? I went to United Healthcare, which, because it's all, and when I went to United Healthcare, I had a Plan F, and it cost me $115 a month. 7 or 8 years later, I said, or 9 years later, I said the premium was up to $220. So I went to USAA and went to a Plan G, and the premium was $145 to start with. After 3 years with USAA on a Plan G, my premium was up to $194. So 2 years ago, I ended up switching to a Humana Plan G, and I went back to $145. And now I'm at $160. And so being 80 years old, that's not too bad. Now, if I have health problems, I can't do that. Another thing to think of a lot of times, you can't go from a Medicare Advantage back to original Medicare and a supplement if you're not healthy. But a lot of people may start with a Medicare Advantage, a Medicare supplement with the Medigap, and when the Medigap gets too high and they feel like they can't afford it, then fine, they can switch to a Medicare Advantage plan. You can always go that route. One of the things I do say is take your time when you choose. Don't be pushed by salespeople. Maybe there are salespeople in here, I don't know. And some of them are good, even if they stick with a particular company. But my thought always is if you can find somebody who represents a lot of companies, they can broker you with a lot of companies, they can find you the best. Also, if you can find somebody who can sell both Medicare Advantage and original Medicare. I didn't put any list in here or whatever it is, but for what it's worth, you go online. There are several companies. There's one called MedicareSchool.com, which is actually in Overland Park, Kansas, but they're nationwide. They sell both, and they help people. I actually went to a company called MedigapSeminars.org, which is out of Florida, and they're the ones that switched me to this Humana plan because they said, which do you want? Here's the reasons for this. Here's the reasons for this. I said, I want Medicare supplement. And they ended up talking to me about it, and they went through it, and they said, here's a good plan. Did they find one cheaper? Yeah. There's a company called ACE, which is part of Chubb, which is the biggest insurance in the company, that had just started, and I could have got a $125 premium there. But their advice, and I agree, was the fact that they're brand new, so they got new people coming in, which means that particular group of people, you're probably going to find the premium is going to go up very quickly after that. So I went with the Humana plan, but you can switch. But don't be pushed. Take your time. Have somebody help you who can tell you what the advantages are here and that and work with your situation. Okay. I put some helpful numbers here to reach a benefits counselor who can help you with Medicare, answer some of these questions, or any other resources in the community. And Brett had talked about ACOG to start with. I put some numbers up here that you can call the intake number, and you can end up getting a benefits counselor that can call you back and talk to you. I don't volunteer and do that anymore, but I did it for 15 years. And then they switched things a little bit when COVID came along, and I stopped. But I still do some presentations. So that's my story, and I'm sticking to it. And I will be around and try to stay around to the end of this if people want to ask me questions.
All right. Thank you, Jim. How many of you feel like you're Medicare experts now? Raise your hand. All right, you're all going to go out in the community, you're going to educate everyone and everything, and you have it all memorized, right? Oh, crap, no, me either. That's good, because one of the things I wanted to tell you is I saw all of you feverishly scribbling on those little notepads we provided, is that everybody who attends this conference, probably sometime within the next few days, will get all of this information emailed to you. So you get all of it in PDF, right? So that's awesome. So if you have handwriting like mine, you're going to go home anyway and you'll be like, I have no idea what I even wrote on this paper. And then you'll just use it for grandkids to write doodles on or to put things on the refrigerator, which is awesome because I love Office Max paper for that. But so we do have people here to talk to you about this. A couple of options for you. Just real quick, obviously you have the telephone number, so if you don't want to talk about these things today, that's okay. Over at the ACOG table, ACOG has forms. So if you would like to sign up for some type of benefits counseling, right, they have a form over here at the ACOG table. See, it's going over there. Awesome, great. Wave your hands. Thank you. So there's that. Also, at the Health Texas table over here, there's a licensed Medicare agent over there as well. On top of being able to talk to people at this event, it's not just about the insurance. So if you have questions about other things, other resources, we actually have people here with laptops. We will meet with you. Just come find a volunteer. We'll meet with you in the back, and we'll actually go through some things with you. So take that time because we want to help you before you leave, obviously. So apart from that, you'll get the presentations today, so you don't have to worry about writing everything down, at least. But you're also going to get a post-attendee survey emailed to you. I designed the survey myself to make it pretty easy. Please fill those out. Our feedback for these events are incredibly important because they help us decide what we need to do better and what we need to do differently next year. Also gives you an opportunity to provide feedback about topics for things that you want for further educational events. That's important to us because we're doing this for you guys. It's what the community needs, what you feel like you don't have enough access to in terms of information and education. We want to meet those needs. That's our primary goal. So anyway, so Jim's still going to be here. You have the insurance people going off. However, we're going to take a quick break because it's time to talk with some of these vendors. And so if you have those questions, now would be the perfect time to ask about them. Yes. Yes, the Medicare over there at the Health Texas booth over there. And then also you can sign up for benefits counseling and things too. So we've got multiple options available to you. See, we tried to meet all you. We're a one-stop shop of ridiculousness. Awesome. Like we really, really tried. But hopefully that makes you feel a little bit better because that is a lot of information to take in. Medicare is a very complicated thing. So awesome. And oh, I'm supposed to be on camera somehow. It's following me, but apparently it doesn't go that far over that way. Great work. Sorry, people that are attending online. So a couple of other things too. For those attending online, we have some options for you as well. We have actually a ton of vegetable bags. So we kind of need to get rid of those. So for you attending online, you still have time to make it in person if you want to come and grab bags after the conference. And then some other various things. We want to make sure that those go out to you guys, and we have too many. They are very heavy. So it's still not too late to join us in person. We're going to break for lunch a little bit and some vendor time. So you might have enough time to make it down before the next presentation. So apart from all of my energy, I couldn't have done this without someone else. So I have a co-chair who actually is a lot more responsible and well-organized than I am. Her name is Jennifer Openshaw, and she helps with our committee. And she's going to talk to you a little bit about our vendors. So everybody give it up for Jennifer. She's my best friend, my mom, and she's got her stuff together, and I love it.
He gives me way too much credit, y'all. It is so nice to see everyone today. So now is the time for all of you in person. Get out there, go talk with the vendors and make those connections. I am going to talk to all the online attendees while you guys go chat with the vendors. So please get on up, go do your thing. Online, we'll give them a minute. All right, online attendees, I'm going to talk to you all. So very quickly, I'm going to have a little bit of a fun time with the vendors here because We have people here that want to talk to you and get to know you. So I'm going to have them each speak to you for about a minute or two, and that's it. I don't know if you remember that old Gong show, but I am very particular when it comes to time management, so we'll get that done. Before I bring up the first one, I want to quickly say the San Antonio Food Bank was amazing. They provided us with 25-pound bags of produce, fresh produce, for today's attendees. So if you are online and you want one of those bags, as Brett mentioned, we have them. Please come down. The conference ends at 2, so come down, come grab this. The whole point of this conference is getting all of these resources and this food directly into your hands, the persons here in San Antonio that need it. I know we have a few persons joining us from other states, as some of the topics we're talking about are very important. So I'm sorry you cannot join us here in San Antonio today. If you ever choose to relocate, we welcome you with open arms. I'm going to start bringing up our people here. Before I do, I want to quickly thank our vendors or our sponsors that couldn't be with us today. Esther with Loss of Life Advocates, or the acronym of LOLA. She is one of our sponsors. The law offices of Bertsch and Bose. Autumn's going to speak with us later, so I'm not going to invite her up quite yet. Of course, we have Health Texas, who I'll have speak with you all in a minute. They provided us with the space today, as they always do, and we appreciate that. And then the Alzheimer's Association. They weren't able to join us today in person, but they're also one of our sponsors. Don't forget, the Walk to End Alzheimer's is every autumn, and it's coming up in your area. All right, Jennifer with Health Texas, please come join me up here. Yes, we're both Jennifers. So everybody, I'm going to have them speak briefly about their organization and what they offer, but I'm also giving everyone a quick question. So I have 2 questions for you. Jennifer, your name is Jennifer. Were you born in the 70s?
Yes.
Every Jennifer's born in the 70s. Okay, and in 3 sentences or less, what is your favorite thing about living in San Antonio?
The community. It's amazing, and the unity that we have here.
Love it. Okay, tell me about Health Texas. What do we do? What do you all do? How do you serve the community, and how can people reach you?
So Health Texas, do I look at the camera? Sorry.
It's a little awkward for us. We're resources.
Okay. So Health Texas is a primary care physician group, Health Texas Primary Care Doctors. We do serve the senior community. We also do serve 64 and younger, but at the same time, we specialize in the senior care in the community. We have 18 locations, board-certified physicians, and our number one goal is every patient, every time. That's our motto. We want to make sure that we build that doctor-to-patient relationship, one-on-one, 24/7 care. We have our doctors on call. Our seniors, for our MA/HMO population, they are definitely going to always see their doctor. Unless it's an urgent care need, we encourage them to call us. We don't want them to go to urgent care. We want them to still come to Health Texas and see their doctor here. So we will fit them in. If it's not with a doctor, it's with a nurse practitioner or a physician assistant.
Excellent. So if you all are looking, if you already have a doctor that you love and you trust, that's excellent. If, however, you're looking for one that better meets your needs, what is the best telephone number to get this process started, Jennifer?
Well, I apologize. I don't have that number with me, but I'll leave my cell phone number, which is perfectly fine. 210-983-7896. Again, it's 210-983-7896. And for those that are in the market right now or turning 65 or even any disability, you have Medicare questions, we work with licensed insurance brokers. So we don't want you picking up the phone. We don't want you getting scammed. Call me, and we will get that situated for you.
Thank you, Jennifer. All right, go ahead and take off. All right, so again, if you're online and you're here in the San Antonio area, you're welcome to join us in person. Next up, I'm going to have Veronica with the University of Texas Caring for the Caregiver. She is here. Come on up. You look very short, Veronica, and you are not that short. She is going to talk to us a little bit about what they do and how they assist our community. But first, I want to make sure all of our online attendees know they were so generous to the Caregiver Coalition this year. They actually gave us grant money, which makes things like this possible. So please reach out to them. They're a great resource in San Antonio. Okay, Veronica, let me think of a different question for you so people can get to know you a little bit. All right, what is your favorite summer activity in South Texas?
The beach. Yeah.
All right, and tell us, what does Caring for the Caregiver do? And we'll start there.
So Caring for the Caregiver program is a program dedicated to allowing caregivers an extension of being able to continue their quality of life while they still assist their recipient of caring for the caregiver. They are able to enjoy still being a part of the community while also being a caregiver. We provide them with educational resources and materials so that they can continue a quality of life to still be able to do the things that they did before becoming a caregiver.
Excellent. Okay, and what's the best way for them to get started with everything you have to offer? How can they reach out to you and connect?
Awesome, that's a great question. So we actually have a website that's dedicated to all caregivers and anyone else that is interested in the events that we do. That is going to be utcaregivers.org. There is a tab within the actual website that has a listing of all of the events that we currently are working on. We invite anyone and everyone, and all of the events are always free.
Excellent. Thank you so much, Veronica, for joining us today and everything that UT Health does for us. All right, next, I know that we are having Joanne with SALSA joining me. SALSA is an abbreviation for Successfully Aging and Living in San Antonio. All right, Joanne, I'm asking everyone an interesting question first before they tell us about what they do here. All right, so let me think of something new. All right, Joanne, what do you like most to do in downtown San Antonio? What's your favorite free time activity?
Well, that's two questions, Jennifer. I don't know. First one is, what would I love to do in downtown? Ooh, well, I'm a native San Antonian, so I love everything there is to do about downtown. Let me just go on and say I love the Riverwalk. Love the Riverwalk, and especially it's going to come up to, it's going to be almost Christmas time, and when the lights are on, you can't beat it. It's beautiful.
That is very gorgeous. It's great for tourists as well, for those of us joining us not from San Antonio. Okay, Joanne, please tell us, what does Successfully Aging and Living in San Antonio, which is part of the San Antonio Area Foundation, what do you all do?
So what we are part of the San Antonio Area Foundation, which is a community foundation, which means that we are here to support our community in very different ways. We have a scholarship program for our youth and those interested in returning back to school, and then we have our program, which is called SALSA. And what we do is we bring all of the community agencies together to work on issues related to older adults. All of our companies and networks and business people that are involved in SALSA, they all are doing their mission and providing their day-to-day operations. When they come to SALSA, we come together at the table to work on these issues at the big systemic issues. Like we're talking about how do we get housing, how do we get transportation, how do we help support people with being socially connected, how do we help people be engaged as far as being successfully aging and living in San Antonio. And news to everybody, we're all aging because aging is so cool, we're all doing it. So whatever we do for older adults now, it's going to help all of us in the future.
I appreciate that so much, Joanne. Thank you for everything you do. And y'all, we're going to have her tell us very quickly how to connect with them because the San Antonio Area Foundation and Successfully Aging and Living in San Antonio, as she mentioned with her dad joke that I love, aging is so popular, we're all doing it. Okay, how do they connect with you so they can get involved and just best assist?
Absolutely. So this, I'm going to leave the material, and we're going to make sure it gets uploaded, but we have our website. You can go to the San Antonio Area Foundation, and you can go to SALSA, and we have a link there, a PDF, to our caregiver toolkit. Since this is a caregiver conference, we're going to talk about the caregiver toolkit. It's available in English and in Spanish to be downloaded. Here we have paper copies of it, and you're more than welcome to take a look at our website and look around there, see for the resources, the information, any of the other information that you might find useful and helpful. And then if you have any questions or want to connect to me, there's an email for us called salsa@sanantonioareafoundation.org, and it's SAAFDN.org. It's a long name, but we're looking forward to connecting with you.
Thank you, Joanne, so much. Okay, Daryl, I am going to have Daryl with Oats or Senior Planet come up next. So, Daryl, my fun question for you, I have a couple of them. Where is the farthest you have traveled outside of San Antonio?
Ooh, I've been to Thailand. I just came back from Hawaii, and I've traveled a lot throughout Latin America.
Excellent. Okay, and where's your favorite place on planet Earth?
You know what? I wouldn't have said Hawaii because to me, I'm not an island person, but my God, it is beautiful. It's magical, expensive, but it is so worth the trip.
Love it. Love it. Okay, so Daryl, I know you are with Oats and Senior Planet. Tell me, and those especially that are attending online, what that is, what y'all do, what your purpose is, and how they can connect with you.
Great. Oats is basically Older Adult Technology Services. That's the name of the nonprofit, but our training programs are called Senior Planet. And what we do is we help older adults incorporate everyday technologies like your phones, your app, and Zoom, so then that they're able to use it and enhance their lives.
Excellent. So I have a quick question for you. Do you offer this training to different senior centers and senior communities and things like that?
Oh, yes, yes. And as we know, today's a digital world, technology is everywhere, so it goes beyond an in-person class. In San Antonio, we do have trainers that go out to all of the DHS senior centers, nonprofits, churches, anywhere where older adults congregate. Outside of Texas, we also have a licensing program to where nonprofit or government institutions can actually utilize, and we train them to get access and to use our curriculum so they're able to deploy it. And on top of that, we also do daily virtual classes based on Zoom to where you can learn about AI, you can learn about Medicare resource tools, and also many other telehealth type of options.
I love it. All right, last question. How can they connect with you?
Right. We're online at www.seniorplanet.org. We also have a toll-free hotline that can help individuals get light tech support, and that is at 210-504-4862.
Awesome. Thank you, Daryl, and thank you so much for providing all of the technology and electronics y'all are seeing here today. They know way more than I do about this stuff.
It's a pleasure, and guess as San Antonio, we're a collaborative type of community, so I'm glad to do it.
Thank you, Daryl. All right, that's amazing, y'all. Next, I'm going to have Stella. Stella is with the VA, the caregiver support section of it. This is amazing. She is here today. So as we know, San Antonio has been nicknamed Military City USA. So I'm sure you are very busy, Stella. But let's think first of a fun question so they can get to know you a little bit. Because you know some people like to connect with people they have things in common with. All right. What is the most daring or thrill-seeking activity you have done to date?
I have swum with sharks and with stingrays.
Excellent. And open water or aquariums?
Open water.
Wow, she's more brave than me, than y'all.
Younger days.
Okay, Stella, please tell me all about what you do with the VA and how you assist those that come to you.
All right, so I work with our caregiver support program. It's kind of an umbrella program. We have two programs within caregiver support. And our big goal with both programs is to make sure that our caregivers have the support, the resources, the tools, the education, all those things that they need so they don't get completely stressed out and burned out. So we have in-person groups, we have online groups, we have online supports, all kinds of things available to our caregivers. And for certain veterans who meet certain criteria, there is a stipend and some other benefits that our caregivers can access.
That's awesome. All right, Stella, how do they connect with you? We don't want to just say go to va.org because you'll get lost. We all know it's true. Okay, can they connect with you?
So, two ways. If you want some general information, our website is www.caregiver.va.gov. And you can also call the caregiver support line. It is open 7 a.m. to 7 p.m. Monday through Friday, 855-260-3274. And then you can connect with us locally at Audie Murphy VA by calling 210-617-5300, extension 119278. That's a mouthful.
That is a lot, but that is wonderful. Thank you so much for everything you do in the community, Stella.
Thank you so much.
All right, y'all. Next, I'm going to have Michael with Promise Senior Solutions joining me. He's another one of our vendors. All right, Michael, thank you for coming up. All right, let me think of a quick, fun question for you. I'm thinking these up on the fly, y'all. I'm not nearly as fun as Brett, so it takes me a minute. All right, what is your most favorite cuisine, and what is your least favorite food?
Oh gosh, my most favorite cuisine, probably pad thai. Okay. Spicy, or very spicy. And least favorite, liver.
Yes, liver. I think all of the all the children in the 70s and 80s were tortured with that, told it would make us strong.
Exactly. Well, my wife loves liver. I have no idea why.
Okay, so Michael, tell me all about Promise Senior Solutions. What do y'all do, and how are you helping the community?
So we provide affordable. Louder. Sorry. Okay. We provide relief for family caregivers that are taking care of loved ones at home, right? Our job is to have our caregivers come in and provide respite care or breaks for those family caregivers. So our caregivers can come out from as few as 1 hour visits all the way up to 24 hours a day, 7 days a week. They can help with bathing, dressing, meal prep, even pet care. And a lot of our providers are specially trained in like dementia care, Parkinson's care, stroke recovery. So for those families out there that really need a break, right? If you're home and you just need to take a few hours for your own doctor's appointments or just to get out and go shopping, our providers can come in. There aren't any minimum hours. There's no minimum visit requirements. And we answer our phones 24 hours a day, 7 days a week.
Thank you so much. And what is the best way that they can connect with you or a member of your staff?
Online at promiseseniorsolutions.com or just call 210-SENIORS and there'll be somebody to help them out.
I don't know how you got that number. That is great and convenient.
It worked out well, didn't it?
Thank you, Michael, and thank you for joining us today. All right, next, I'm going to have Rachel. She's with the Village at Incarnate Word, another one of our sponsors. She's going to come up and join me.
Hi.
I've got a fun question for you, and then I'll hand you the microphone. All right, Rachel. What is, let me think here. I need to get more like Brett, get more energy. Okay, what is your favorite thing that you are paid to do?
Meet new people.
Oh, I love that. Okay, Rachel, tell me all about the Village at Incarnate Word.
So the Village at Incarnate Word is a senior living community located in Alamo Heights. It is right between the University of the Incarnate Word and Central Market if you're from San Antonio. And we are the retirement community for the Sisters of Charity of the Incarnate Word. But we also welcome folks, lay residents to our community. We just celebrated our 37th anniversary.
Congratulations. That is huge. I have more questions about what you just said, but very quickly. The image behind you, is that some of the residents of the Village at Incarnate Word? I don't believe it's a stock photo, is it?
It is not a stock photo. So those are actual residents, and I know one of the sisters that's there. And yeah, so those are actual real-life people.
Excellent. You mentioned that the Sisters of Incarnate Word are there in addition to lay persons, so non-Catholic individuals. That means regular citizens. And I've heard a rumor that the Village at Incarnate Word is actually very diverse and welcoming to all. They do not have to be Catholic. Is that correct?
That's absolutely correct. I was just having a conversation with some of the guests in the hallway that there is a misconception that the Village at Incarnate Word is either only for Catholic sisters. Not true. Lay residents are welcome to the community, and that you have to be Catholic to live there. Also not true. While we are very proud of our Catholic heritage, everyone's welcome at the Village at Incarnate Word. We have ecumenical services year-round, and we also welcome people of all faiths and no faith. Everybody's welcome at the Village at Incarnate Word.
Thank you, Rachel. Okay, lastly, what is the best way they can get in touch with you or someone about the Village?
There's a few different ways to get in touch with us. You can go to our website, www.thevillageiw.org.
You can call us 210-829-7561. Just stop by. Just driving down Broadway, just stop in and see us, and we'll be able to help you.
Thank you so much, Rachel. We're so glad you're here today. You're very welcome. All right. Next, I'm going to bring up Christine. Christine is with Texas Healthcare Solutions. They are also one of our sponsors today. All right, Christine, I'm asking everybody a get-to-know-you question. Are you ready?
Absolutely.
All right. What is your best dish or most tastiest dish that you can prepare from scratch?
Ooh, chicken Alfredo.
Oh, yummy. That appeals to a lot of us. Okay. Tell me, Christine, tell me all about Texas Healthcare Solutions. What do you all do, and how are you helping the community?
Well, Texas Healthcare Solutions provides a continuum of care services. So we provide skilled nursing and therapy, palliative, and hospice care here in San Antonio. We're also the only agency in San Antonio that provides a Jewish faith-based hospice program.
Wonderful. Okay. So explain more. You mentioned palliative among a few other things. What does that mean? I know what that means, but I know not all citizens know what that means. Can you tell us a little bit more about that?
Absolutely. So our palliative program, it focuses on symptoms and pain management for patients that have a chronic disease, and that's progressive, and they just need that additional medical care services at home because this program is provided at home.
Perfect. And what is the best way of reaching you or someone at Texas Healthcare Solutions, Christine?
Absolutely. To schedule a home education visit regarding our continuum of care programs, you can reach me, Christine Sanchez, at 210-421-9111, or our main number is 210-877-5222.
Excellent. Thank you so much for joining us, Christine, and thank you for being a sponsor. Nice to see you as well. Okay, next I'm going to bring up Robin with Adroit. She will tell us all about what Adroit does, but let me think first of an interesting question for Robin. Okay.
Thank you so much.
You're welcome, Robin. Okay, I'm asking everyone a get-to-know-you question. So, and I think it up on the fly. I want to know, your hair is gorgeous. Is that all natural?
All natural, God-given, mother-made. I just decided 4 or 5 years ago just to go natural because I was tired of coloring.
I love it. I think it's gorgeous.
So freeing.
Absolutely. Okay, tell me all about Adroit. What does Adroit do, and how is it helping the community?
So we're a medical equipment company. We've been in business for 26 years. We are strictly a private pay company. We provide anything that makes you independent, mobile, and active. We have a walk-in showroom off of Eckert Road and Bandera Road where you can come in and try out the equipment before you purchase. And we love helping our seniors. We just love it. Thank you so much.
Thank you, Robin. And what is the best way of getting in touch with you so they can learn more about what you have that could benefit them?
Our phone number is 210-682-7000 or our website, adroitmedicalequipment.com.
Thank you so much, Robin. We appreciate you being a sponsor and helping us here today. I'm sure you'll enjoy chatting with all the attendees.
Oh, absolutely. I love them. And you're a darling.
Oh, thank you, Robin. Okay, I'm going to next have Lupe with Texas Grandparents Raising Grandchildren, another one of our resources here in town.
Jennifer. Hello, everyone. How are you all doing?
All right, I'm going to think of a question to ask Lupe. I'm doing a get-to-know-you question. Okay, so this one's a little bit work-related, but I am curious. What made you want to get involved with Texas Grandparents Raising Grandchildren? What drew you to them?
Well, the reason was that I am raising a grandchild, really a great-grandchild, and I had already raised one granddaughter. So that was my main reason, and I was very happy that I did.
I love that. So this is something that's near and dear to your heart. I know all the sponsors can say the same, but I just wanted to ask that of you, Lupe. Okay, Lupe, tell me all about Texas Grandparents Raising Grandchildren. What do you all do, and how are you supporting the community?
Well, the way that we're supporting the community is that we have outstanding and ongoing support groups for our grandparents that are raising their grandchildren. We are also out there in the community looking for resources for all of the grandparents that are raising their grandchildren. We try to work with the grandparent as closely as possible for the benefit of the grandchild. This year we were able to, with the help of other agencies, ACSC being one of them, being able to provide school supplies for the grandchildren, clothing, shoes, meals, whatever we can to make it easier for the grandparents.
I love that. Thank you. And I believe every year you do a back-to-school drive as well. Is that correct?
Yes, we do. And I think we were able to take care of 300 children this year, if I'm not mistaken. But yes, a big one, yes.
Excellent. So if they want to get involved, whether you are a grandparent that is also raising your grandchildren, or if you want to donate to this nonprofit and help with their back-to-school drive, what is the best way of reaching y'all?
Well, you can go to the website and look for the Texas Grandparents Raising Grandchildren, and you can volunteer to there or call us and connect with us to there. Or you can call me directly, and my number is 210-347-1173, and I can connect you to the right person.
Thank you so much, Lupe. I appreciate you being here today. Thank you for sponsoring.
Thank you, Jennifer. Thank you.
Bye-bye. All right, next, I'm going to have Cindy. She's with the WellMed Caregiver SOS program, and she's going to tell us more about that. But Cindy, first I'm doing a get-to-know-you question. Are you game?
Am I game? Of course.
Okay, Cindy. Let's see here. I'm trying to think of something I haven't asked others. Let's see. What is your favorite activity that's outside to do in the winter anywhere in the state of Texas?
Anywhere outside the state of Texas.
Anywhere in the state of Texas that's an outdoor activity in the winter.
I probably would have to say running.
She's putting some of us to shame. I'm not a runner, unless I'm running my mouth.
Or like going for hikes.
I love it. I love it. Okay, Cindy, tell me more about the Caregiver SOS. What do you all do, and how are you making a difference here in the community?
Absolutely. So our program really focuses on those informal caregivers, right? Those that don't get paid, that do it because they have to, right? Because that is their loved one. And so what we do is we support our caregivers by providing them with information, guidance. We have support groups that anyone can join in person or online. We do have 2 great evidence-based programs that really focus on how to get our caregivers to recognize the importance of taking care of themselves while they're caring for a loved one, and we really focus on coping with the stressors associated with caregiving. And so we're open to the community. Our program focuses on, again, those that are providing support to a loved one over the age of 60.
Excellent. That is wonderful. So you're really directly helping the caregivers here in San Antonio, and not just the professional caregivers, but more the family caregivers, or we call them unpaid, those that don't always recognize they're a caregiver. I want to quickly ask you a question. I know the answer to this, but I know not everyone else does. What makes someone a caregiver?
So, great question, Jennifer. Just like I said, informal caregiver. So when we ask someone, are you a caregiver? And they say, no, I'm just the daughter, I'm the spouse. I'm caring for my loved one, but you know they don't really associate it with being a informal caregiver. And so a caregiver looks like someone that takes their loved ones to medical appointments, picks up medication, provides medication management in the home, helps in any capacity to make sure that that person that once was able to do those things independently is no longer able to. And so when you identify as such, you're a family caregiver or an informal caregiver.
Thank you so much, Cindy. Okay, one more important question. How can they best reach out to you, connect with you, and get started with Caregiver SOS?
So you can call our 800 number. We're at 1-866-390-6491, or you can find us on the WellMedCharitableFoundation.org website.
Thank you so much, Cindy. Thank you for being a sponsor here today.
Of course. Glad to be here.
Thank you. Okay, I have one more vendor or sponsor I want to bring up. I have Jill with Gray Matters here today. So I'll start with my first fun question before we learn about Gray Matters. Are you game for a fun question?
Yes. Bring it.
Okay, let me think of something fun. Okay, what is the most exciting thing that you have planned before the end of this calendar year?
Oh, okay. Well, my daughter gets married this year, and I'm also traveling in October, going to several states. So I'll be going camping and hiking. So.
Jill sounds like she has a very busy rest of the year left. Okay, Jill, tell me all about Gray Matters.
Okay. So I am what's called an aging life care manager and also a caregiver coach and advocate. So I try to help families direct them through issues that they may be having and working with them on caregiver concerns. But I do in-home assessments that are comprehensive, and I also create a plan of care and help coordinate care if needed.
I love that. So it sounds to me like what you're saying is, let's see here, put it in real world application. I have 6 children of my own. If I am older or perhaps have a chronic condition where I can't make my own decisions and my children disagree on the next best steps for me, is that something that you could assist with?
Definitely. So it's working with the family unit, whether everybody's communicating or not. I even have long-distance caregivers that I'm working with. I'm doing coaching for them. So they don't always have to be in town. It's just a matter of doing Zooms or phone calls, whatever is most convenient.
Yep. I love that. Thank you. That's definitely needed, especially here in South Texas, where we have multi-generational households and things like that happening. What is the best way to reach you, Jill?
Okay, you can reach me on my cell phone at 210-363-3554, and you get me. I have no staff, so you actually are calling me, or you can go to my email at graymatters64@gmail.
Thank you so much, Jill, for being a sponsor. All right, I'm going to bring up somebody that's been helping me get the sponsors up here today. So as much as we all do volunteer work and we love what we do, we also do other things as well. So he's a little bit shy. I'm welcoming him up. Thank you so much, Sergio, for helping bring all the vendors up. You're with American Medical Home Health, correct?
Yes.
Thank you so much. You have a lovely day, and thanks for being a volunteer with us.
No, thank you for having us.
Excellent. Thank you. And of course, I am Jennifer Openshaw O'Brien. I am the co-chair here with the Alamo Caregiver Support Coalition. This is our annual conference event. As an employer or employee, I'm the administrator with Sisters Care, in-home care, which is part of the Village at Incarnate Word. All right, all of you online attendees, take a quick break. We're going to have our speaker come up in a little bit, and all of our in-person attendees, please grab your lunch. It is in the back. Get ready, get settled, use the restroom before our next speaker comes up. And again, if you are home currently and you want to come join us, you are welcome to come join us. We have those bags of produce that we are not keeping. They are coming or going home with each of you, thanks to the generosity of the San Antonio Food Bank. Again, in-person attendees, grab your lunch. There'll be nobody on camera for a minute, but that's okay. We'll be back momentarily.
Hello. I got your clicker. I think they were working on that, so it's like forward and
forward and backwards.
Yes.
Okay, thank you.
All right. Okay, everybody. We're going to get started with our next presentation. How's lunch? Is it good? All right, great. We want to thank some of our sponsors, especially the food sponsor today was the Area Foundation's SALSA, or Successfully Aging and Living in San Antonio. We're very grateful to Joanne Tobias Molina and Sarah Davis for being here and to help sponsor the food today. We're real grateful. Yeah, thank you, SALSA. And thank you to UT Health Caregivers Program. We have Veronica and her team outside, so we're very grateful to them as one of our big sponsors, and also Health Texas for this beautiful space, right guys? They donated the space, so thank you to Health Texas. They've done, it's their second year, we're so grateful. So I'm very proud to introduce a colleague and friend, Autumn Puckett. She's our next speaker, speaking on legal issues and Medicaid answers. Autumn is an elder law attorney with the firm Bertsch and Bose. They are a local firm that's been in business for, almost 30 years. Wow. So Carol Bertsch started this practice, and Brennan came on as partner in January. And so Autumn is also an elder law attorney, and she's an amazing speaker. If anybody needs her to come and speak at your civic group or speak at your faith community, she loves to speak and present, and she does an amazing job. So I'm going to turn it over to Autumn. Please welcome Autumn Puckett.
Thank you. Thank you, everyone. So happy to see all your faces today. Okay, so we're going to talk about Medicaid. So I know that for most of us, we want our loved ones to be at home as long as possible, and I will talk about some options for that as well. But sometimes we get to the point where we need long-term care, and that's where we can really, really help the families to preserve assets while also making sure mom or dad or your loved one has that long-term care that they need. So in general, I want to kind of give an overview of what elder law is. Most people have never heard of it. You think of family law, insurance law, all the usuals. Elder law is a specialty type of law that focuses on seniors, persons with disabilities, and their families. So we can do estate planning, where we can help with wills, powers of attorney, trusts. And I want to specifically point out that most people think you have to have this big estate to benefit from estate planning, and that's not the case. You can have a very simple estate with a home, a car, and bank accounts and still benefit from powers of attorney, a will, and avoiding probate. Probate is another service that we offer, which is assisting families with getting their property, their gifts, to their loved ones. And having a will is the most advantageous and cheapest way to go about that. Special needs planning. If you have a loved one who has a disability, whether they're young or old, we can help with special needs planning. And finally, what we're here to talk about today, which is long-term care planning and Medicaid eligibility. So I'm really going to dive into that today. It's very important to talk about the legal documents we're going to discuss today because they can directly affect our ability to help your family if and when that time does arise. Also, we do house calls. So if you have a family member who is disabled or even just prefers to be at home, we can come to your house as well. Is it going? I think it just died out on me. Okay. Oops, there we are. Okay, so nursing home costs are typically around $5,000 to $10,000 per month in San Antonio. That is astronomical. Who can afford that? The large majority of the population, it's completely out of reach. And earlier, as Jim had mentioned, Medicare and supplemental plans do not pay for long-term care. So if you find the need of nursing home care in your future, we're sort of at a loss. You'd have to end up spending all the way down of your, hard-earned money that you wanted to pass on to your children just to qualify for care. So we're here to help you and to advise that there are other ways to be able to do that. People are then required to either private pay. There's ways that you can stay home longer. I don't know if y'all are aware, there's adult day health centers here in San Antonio. There's one called Clear Day. They have a facility or a location off Bandera and also a new one in New Braunfels. But it's a Monday through Friday opportunity to drop a loved one off and have personalized care with other seniors. And it allows the caregiver at home who still maybe needs to work to sort of supplement that income into the home, or maybe they just need their parent to have some socialization. It's a good way for them to have a place to go for the day, Monday through Friday, and also provides that much needed respite for the caregiver who's at home. Also, other private pay would be care homes. Personalized care homes are an option. Sometimes people don't want to go to a formal nursing home care. They want to do more of a private, personalized option. And there are care homes out there that provide the service for a much smaller cost than the nursing home care. But again, if you have dementia or you have a progressive disease or diagnosis where nursing home care is necessary for safety or for other needs, then we're going to have to be in that Medicaid realm at that point because we would need assistance to pay for that. Okay, so Medicare, as Jen said earlier, health insurance over 65. There's no financial eligibility to require. You just turn 65 and you're able to start signing up for that. Regular Medicaid, that's for those who have limited means. And there are income and resources requirements, same as we're going to talk about today. But there's a special program for individuals who need long-term care, and it's called Medicaid for the Elderly and Persons with Disabilities, MEPD. So if you ever see that, that's what we're talking about today. I'm going to call it Nursing Home Medicaid just for short because it's easier to refer to it that way, but there's also income and resources requirements for that. So let's get into it. So nationality and residence, that's going to be the first element to qualify. They need to be over 65 or disabled or blind. If that person's under 65, they can just verify the blindness or disability and still qualify. There are income and resource requirements that I'm going to dive into today, and also medical necessity. They would need to have medical necessity for a skilled nursing facility or community, as we like to call it, and they must reside in that community for at least 30 consecutive days to qualify. They must need to be in the nursing home. A lot of people think it's the opposite. You have to apply and then go into the nursing home, but it's actually switched. Okay, nationality. U.S. citizen. You can also be lawfully admitted for permanent residence or just otherwise permanently living in the U.S. legally. Residency, you need to have intent to remain in Texas. So this is tricky. So we have some clients who they have a homestead here. Now I'm going to get into it in a minute, but homesteads are exempt in Texas. So let's say you have a single person and they're going to go into a nursing home. Some people are preparing their Medicaid application and they're confused whether to checkmark intent to remain in Texas or intent to stay because they're thinking, well, my parents probably not going to go back home. They're not physically able to go back home, but you need to checkmark yes, intent to remain, because there's the possibility one day that person can go home in Medicaid's eyes. So that's how the home remains exempt. So you're going to want to checkmark yes to that, just a little foreshadowing. And there's no length of residency required. Your parent who lives out of state can move here to Texas and can immediately apply. Another tip for you, a new change for Medicaid, if some people like to do a spend down where they can purchase a home here in Texas for mom or dad and then have that be their homestead, exempt from Medicaid. Medicaid has a new rule where the parent would need to live in the home for at least 30 days for that home to be considered a homestead. So keep that in mind when you're timing out how much to spend down for that nursing home care. Okay, so medical necessity. The person who's needing care has to require the services of a licensed nurse, 24-hour care, in an institutional type setting. So this can be a little tricky, especially when we don't know if certain diagnoses or certain conditions are going to require that 24-hour care. We are not given any guidelines about this from Medicaid, and so when clients come in and we're trying to help them qualify, sometimes there's sort of the question of, I can't really tell you if Medicaid's going to approve the medical necessity part, but dementia in general, you're going to be approved because anyone who has dementia is going to need medication management at some point. And for Medicaid, medication management is that key need that they look for as well. So that is also something to consider. Even if it's mild diagnosis of dementia, dementia alone is a medical necessity qualified. Okay, so let's get into income.
So the gross monthly income cap to qualify for nursing home Medicaid is $2,901 a month. Now, some people make more than that. They may have IRA distributions that are coming out. Maybe they have Social Security that exceeds that amount. That is okay. Income is never a barrier for eligibility. We can do something called a qualified income trust. It's a special trust. Some people know it as a Miller trust. It's a trust that's only for your income, and it allows you to qualify and to bypass that Medicaid eligibility issue. So essentially how it works is the large majority of the Medicaid applicants' income will go to pay the nursing home. They're allowed to keep some things. So I'm going to talk about spousal diversion later, but they can divert some of their money to the spouse if needed. They get to keep $75 for a personal needs allowance. I don't know what you can buy with $75 these days, maybe one bag of groceries, but, you know, whoop-de-doo, have fun with your $75. I will say it's been increased from $60 recently, so we're making some headway. Okay, and just keep in mind, income is never a problem. The person who's needing Medicaid, we can help you. I don't care if you make $5,000 a month. We can still help you get Medicaid. Okay, resources. So this is where it gets tricky. Countable resources for Medicaid. You cannot have more than 2,000 in countable resources. The key word is countable. There are resources that are not countable, and there's resources that are countable that we can turn into not countable. And I'm going to get into that in a minute. But what are countable resources generally? You have bank accounts, investment accounts, retirement accounts. Let's say you have an investment property in another state. You have mineral rights that you inherited. Maybe you have a farm, interest in a farm somewhere that you inherited from a family member. Life insurance policies, they often have cash value. So if you have maybe a whole life policy, you'll have a little bit of cash value accrued. That cash value is part of your countable resources, and that can trip people up sometimes. I've seen people accidentally thinking they're eligible. They go through the nursing home does the application. Yep, you're going to get approved, and they get denied over and over and over, and they don't know why. They come and see us, we do a deep dive, and we realize, oh dear, you have about $4,000 in cash value on this life insurance policy. You're going to have to fix that, or you will never be approved. Meanwhile, they've been paying private pay in that nursing home the entire time, and a chunk of money is gone that we could have saved. So that's something to remember. If you're married, how Medicaid looks at it is they take the assets of the couple together. So it doesn't matter if you have separate property that you inherited from a family member, because remember, separate property or inherited property is separate. Little tip for you, if you inherit money from someone, please don't commingle that money with your spouse if you would like to keep it your separate property. Make sure that you put it in a separate account in your own name and don't allow that money to intermingle with your spouse. That keeps it separate property. For Medicaid purposes, everything is considered in a bowl. They put everything in a bowl, they split it down the middle, and they say the spouse who needs care, their side has to spend down to $2,000. The side the spouse at home who doesn't need care, they can keep up to a certain amount. And I'm going to talk about that in a second. But just remember, it doesn't matter what kind of property it is, separate or community, it's all in the same bowl. Okay, what are exempt resources? So we have your homestead. If you're a single person, up to $730,000 in equity. That's awesome. You would think you'd have to have a teeny tiny little home and only worth like $200,000 to qualify. Absolutely not. And here's something better. If you're married, no limit. You could have a $2.5 million farm and be married, and the homestead is exempt. They don't put a cap on married couples. Contiguous land is also exempt. So let's say you have your homestead, but maybe you bought the property next door. That's contiguous land. It's sort of connected. That's also exempt. A vehicle at any value. So if you have a Mercedes-Benz, that's, $90K, and that's okay. And often, this is a great spend-down strategy. Let's say you have this old jalopy that's $5,000, worth $5,000. You have to keep putting money to upgrade it. Sometimes you can spend down and upgrade your car so that your spouse at home now has a reliable vehicle moving forward. That's an approved spend-down, and you also have the benefit of spending on an exempt resource. So you're just benefiting yourself in the process of that spend-down. Prepaid funeral plans are also exempt, up to $15,000. Just make sure they're irrevocable. If it's a revocable policy where you can get that money back or you can sort of get cash out of it, those are not considered exempt. You would have to make them irrevocable. And traditional IRAs and payout status, this shocks people. You could have $1 million in your IRA. If your IRA is paying out the required minimum distribution, that IRA, the bulk of it, is exempt, off the board. Medicaid pretends like it doesn't exist. They take the income that the IRA produces every month, or sometimes they'll do a yearly distribution. They'll divide that per month into 12 income payments. That goes into your payment to the nursing home. But the IRA itself is invisible. So don't worry if you have all your money is focused in your IRAs. That's actually a good thing. We want that. And if your IRA is not already in distribution status, there's things that we can do to make that like say it's a 401k, we can roll that 401k into a deferred annuity or some other exempt asset in order to keep it protected. But keep in mind, there's no Medicaid rules on this. They have not put anything in writing, but they've been sort of having this policy run for years. So we are just wanting to put that out there. There's nothing in writing, no Medicaid handbook rule about this, but they've been honoring this for many years. So we are hoping that continues. Okay, prevention of spousal impoverishment. This is a big one. So whenever you're married and your spouse is going to need care, we don't want the spouse at home to become impoverished or go into bankruptcy because they're trying to pay for care, or God forbid, the person going into care, they're the person that has all the income. Because, oh no, if all their income's going to pay the nursing home, how is the spouse at home going to survive? How are they going to pay the bills? So how it works is, the spouse at home keeps 1/2 of accountable resources up to $157,920. Everything else above $157,920 has to be spent down, okay? So remember that the spouse who's going into care, they can have up to $2,000 in countable assets. So anything in their name needs to be under $2,000. The spouse at home can have up to $157,920. Here's where we can get creative. So anything above that $157,000, we can either, I'll get into it in a little bit, but we can make those countable assets not countable. And minimum, so if the couple together has less than $31,584, you're already ready to qualify. You're ready to go, apply. You don't have to spend down anything because that's such a low amount. Medicaid understands, okay, we've reached the threshold. So below $31,584, apply. Above $157,920, you're going to have to start spending down. Okay. Oh, and let me go back. So remember, too, how everything is in a bowl and split down the middle. You take the whole amount of that and you split that in half. So I'm going to give you some examples. So let's say the couple has $300,000 in countable resources. Let's say they have investments and stocks and things like that. So the spouse at home gets to keep $150,000 because remember, it's 1/2 of that $300,000. They take the bowl, split it in half. The other $150,000 has to be spent down below $2,000 for that spouse to qualify for Medicaid at that point. If they have $30,000, well, they're below that $31,000 that I just mentioned, immediately qualify. Nothing has to be spent down. And finally, let's say they have $500,000 in countable resources. Well, we got to hit that max of $157,920. So anything above that is going to have to be spent down. So that's where we need to get creative. Okay, so here's the spousal impoverishment for income. So let's say the spouse at home maybe makes, I don't know, a couple $1,000s in Social Security, but the spouse who needs care is getting pensions and they make $5,000 or $6,000 a month. Obviously, the spouse at home can't survive on $2,000 a month. So Medicaid understands this. They allow income diversion. So the spouse at home keeps all of their income, regardless of what that is. They can have income of any amount. The spouse at home could have $10,000 a month and Medicaid doesn't care. It's the income of the applicant that they're concerned about. So if the community spouse's gross income is less than $39.48, that's the 2025 max, then more of the money of the spouse going into care can be given to the spouse at home to bring their income up to $39.48. So if you only make $2,000 a month, you can pull some of your spouse's income to yourself instead of going to pay that nursing home. So let's give you an example. So we have the institutionalized spouse who's needing care. Their gross income is $2,000. Community spouse's gross income is also $2,000. Well, obviously, spouse at home can't survive on $2,000. So Medicaid allows $1,948 of the institutionalized spouse's income to go over to spouse at home, bringing their income up to $39.48. Now your copay to the nursing home is only $52. We also forget you get to keep $75 in a personal needs allowance. So now your copay to the nursing home is $0, and Medicaid just pays everything. Okay. Prevention of spousal impoverishment when both spouses' incomes are below that $39.48. This is so awesome. We have been really able to help families pretty much save everything that they have. So let's say both families only make, $3,000 a month. Medicaid has a special formula where they determine how much more a couple can keep. It's based on a 1-year CD rate. Y'all would go snooze to sleep if I tried to explain it to you. It's a math equation. But basically what they do is they say, how much money would we need to fund a CD to produce enough income to reach that $39.48? So if they only make $3,000 a month, I need to find a CD that would produce enough income per year to overcome that $948. Well, that's a lot of money. You'd have to fund a CD with a pretty big amount to produce that much interest. So that's how they're able to basically protect more. Y'all will go snooze to sleep if I try to tell you. Okay, but if y'all want to come talk to us about it, I can break it down more specifically. Okay, spend down. So let's spend down on things that you already have and that you can keep. Repairs to your house are a big one. So let's say you have a spouse at home and they're needing to go into care. Maybe the spouse that's still remaining at home one day might need, chair rail or wall rails like we talked about earlier. They might need a bathroom renovation for a shower that they can walk into. They might need larger doorways for wheelchairs. You can actually repair the home for the spouse that's at home for future needs as well in order to properly spend down on an exempt asset because you're increasing the equity of your house. New vehicle, as I mentioned earlier, you can upgrade the vehicle that you have. One vehicle is exempt of any value, so I don't recommend buying a Maserati or something, but you can buy something, expensive if you wanted to, but be aware of insurance. Prepaid funeral plans, again, you can do that. If y'all are interested, I actually brought Funeral Consumers Alliance information. They actually partner with Funeral Caring USA, and you get discounted rates on your funerals or cremation services, like deeply discounted rates. So if y'all want any information, come talk to me later. I'll get you that. Dental work is a big one. Most of us sort of fall behind on our dental needs, especially for our seniors. That's another way to spend down. That's an approved spend down as well. But please do not gift money away. Some people think, oh, I'll just gift a bunch of money to my kids, and then it'll stay in the family, and then I can qualify for Medicaid. But that's where most people go wrong. So what are the transfer gifting rules? Most people have heard of the dreaded 5-year look back. Well, that's what we're talking about here. So a person is ineligible for Medicaid for 1 day nursing home care for every $242.13 that they transferred to someone else that was less than fair market value or just giving something away. So let's say you sold a car that was worth $15,000 and you sold it for $10,000. Well, there's a $5,000 deficit that Medicaid's going to penalize you for. And how they look at it is, if you're going to be giving money away, why are we paying for your long-term care? And I can understand that, but we just have to be very careful in how we gift. You can still do it, but there's special ways to go about that. Anything over $200 is considered a gift. That includes paying people's bills. I've had clients who have paid their children's electric bills for years, and tithing to church, that's considered a gift. So there's something that we're going to have to overcome. We can do affidavits, or we can try to explain to Medicaid that this gift done 4.5 years ago was not a gift in preparation for Medicaid or to anticipate needing Medicaid. We've been fairly successful with those, but there's no guarantee that Medicaid's going to accept our affidavit. They might just say, oh, too bad, you're going to be imposed a penalty, and we don't care that you gifted your granddaughter a car 5 years ago, or 4.5 years ago. So 60 months, they look back 60 months, and I promise y'all, they will find it. I have had people try to hide bank accounts, try to hide a vehicle they gave away to their grandkid. They will always find it, I promise you. So just foreshadowing for yourself, if you feel like if a diagnosis has been received by your doctor, even if it's mild, start considering this now, because it might progress to the point where you need Medicaid assistance, and it's going to be harder for us to try to explain those gifts later or to try to overcome that penalty. It's better to try to preempt it now, or as soon as you are aware that the problem might be arise and you might need to make some other arrangements. And again, it can be making a down payment. I've seen so many people that just gift their car away to charity during their life. Maybe they don't drive anymore, and so they'll just gift their car, which is so wonderful. But when it comes to Medicaid, they don't look kindly on that. They'll still penalize you for it. And again, affidavit, no guarantee it'll work, but I will certainly try my best. And I write a very comprehensive affidavit on your behalf whenever I need to. So let's give you an example of gifting and what it looks like. So mom gives daughter $10,000. You divide that $10,000 by the daily rate of a nursing home, which is $242.13. That equates to 42 days of ineligibility. That means private pay. So if you've already spent all your money down to prepare for qualifying for Medicaid, how is that going to happen? Usually the adult children or family members have to step in and help pay, and that is a big, big problem for the families who are trying to help their parent get that long-term care. So a second example, which is a much more impactful example, mom gives son $50,000. Divide 50,000 by 242.13, 207 days of ineligibility. That is insane. You're private pay that entire time. And if you need full-time care at that point, we've got problems. And essentially, the more you give away, the longer you're ineligible for Medicaid. So just please keep that in mind. Okay, transfer rules. So many people think, oh, I'll just gift it now, and then I'll just transfer. I'll do the math in my head, and I'll calculate the penalty, and then I'll just apply it after my penalty period runs out. That's not how Medicaid works. They've already thought ahead. So they say, well, your penalty starts when the applicant would otherwise be eligible for benefits. So after you've spent down, after you've got your Miller Trust, everything all done, and then you're ready to qualify, that's when your penalty period will begin. So they got wise to our efforts there, but it's unfortunate. Okay, so let's talk about transfer strategies. So sometimes we want to gift on purpose because we want to be able to preserve some of our money for our loved ones. So let's say you have a single person and you want to try to give some of your estate away to your kiddos. Well, you intentionally gift. So we would purposely gift half of the resources. We know it's going to cause a penalty. But what we do is we take the other half of that money and we purchase what's called a single premium immediate annuity. We call it a SPIA for short. And it's essentially an immediate annuity that begins paying that next month. So it starts to provide a stream of income to that person that's at home or to the single person who's going to be needing care. How this works is when you're buying this annuity and you're creating a stream of income, you're starting to pay yourself a monthly income that can cover your long-term care while that penalty period is running. So you're still getting the care that you need. You've already gifted half of your estate to your loved ones, and then the annuity will time to end right at the point of when you start to need care and when Medicaid will become eligible, or when Medicaid becomes eligible for care. Okay, pros. You're immediately eligible because once you've purchased this annuity, that money is off the board. It's gone. But then there's cons. You've also spent half of your assets on your nursing care. So there's also annuity costs and fees we have to talk about. So whenever you purchase an annuity, let me back up here for nursing home care in general. There are wonderful nursing home staff who are able to do your application for you. You don't have to pay an attorney to do it. You don't have to pay these special Medicaid companies to do it. The problem is some of them don't know what they're doing. Remember the life insurance cash value I talked about earlier? That was an accident from someone who worked at a nursing home because I just didn't know. So sometimes you have to be very careful when you're having the nursing home do the application because your estate might need something a little more formal, an attorney to step in. An annuity is an example of that. Nursing home staff don't know what to do with an annuity. They don't know how to put that on the application to justify that. So you would have to likely pay an attorney to do the application, which can be several $1,000s. It's a lot of attorney time. And there's also annuity costs, probably around $2,000, I guess. But if you're saving $50,000, $90,000 of your estate, it may be worth it. So just something to consider. I wanted to make sure you have full understanding of what it costs to do these kinds of annuities. Also, too, for a single person, they would need a power of attorney that has those gifting powers. I'm going to talk about that in a minute, but if your loved one has a bank account with only their name on there and you have no access to that account, I can't help you purchase an annuity because your power of attorney limits your authority. So at that point, we're stuck and we can't do this gifting option. So that's something also to consider with the power of attorney is updating them with the proper language for unlimited gifting and trust creation, which I'll talk about later. Okay, married couples. So there is an exception to the gifting rules. You can gift between spouses and it's not penalized, but the problem is Medicaid puts everything into a pot and they split it down the middle regardless of whether it's separate or community property. So that doesn't really make sense to help the family because both spouses' assets are counted together. So we can't really benefit from that, but you can use the excess money over that $157,920 to purchase the annuity. You can turn that money into income to your spouse at home, because remember, the spouse at home can have income of any amount. So let's say you've got $100,000 in extra money, you purchase that annuity, and then all of a sudden spouse at home, they're getting a $5,000 a month income in addition to whatever they're already making until that annuity runs out. And then you've saved all that money, and the spouse was immediately eligible because we took all that countable money and we put it into a non-countable asset, an exempt asset, which is that annuity. So another spending strategy that is able to work. Again, you preserved all your assets. You can make sure your spouse at home maintains that standard of living and preserved all that extra money that you otherwise would have spent down. But again, annuity costs, fees, and you can only do this if your financial power of attorney has that authority, or maybe other family members already have access to all of your bank accounts and financial assets, which most people don't. Okay, the dreaded MERP. Everyone knows about Medicaid estate recovery. If I get Medicaid, Medicaid's going to come take my house. Yes and no. So what happens is Medicaid keeps that running tab of how much money that they've spent on your loved one, and when that person passes away, they'll send you a lovely letter letting you know that this is the total amount that we've spent on your loved one, and we are very sorry for your loss, but we would like to be paid back. Well, for most families, what's left? If you've already spent down everything to help that person qualify, your house is really the only thing that's left other than a car. So most times families have to sell the home to reimburse Medicaid, or the value of the home is so low that they end up Medicaid just gets the value of the house anyway. So unfortunately for families, this leaves nothing left of passing down your assets to your children. So what are the exceptions to estate recovery? Surviving spouse. If the surviving spouse is still living, when the Medicaid recipient passes away, they drop the claim. It goes away. If there's a surviving child under the age of 21, this can happen if we have disabled persons who need assistance, drop the claim. Surviving child of any age, blind or disabled. This is my favorite. Unmarried child residing continuously in the home for 1 year prior to the Medicaid recipient's death. What happens when most adult children care for their parents? They move in. Stay living in your parents', exactly, hi Brett. You stay living in your parents' home even after they need care, right? Don't move out. Because if you're still living in the home after your parent has passed away, you can have that qualify as an exception to Medicaid. When they send you that letter, you fill it in. I'm an unmarried adult. Now, if you have to be unmarried, so if you're married, this won't work. But you fill in that information. Nope, I'm unmarried. I've lived here. You show your power bill, that this is your address and all of that. They'll drop the claim for the house. And that's it. Some other exceptions, if you have a sibling or direct descendant inheriting that homestead and maybe they're 300% below that poverty level. I've actually seen this work where we had a son who was he was on social SSI, he didn't make any income, bless him. So we were able to get the home exempt just because he was the only child left and was able to keep it that way. Sometimes also it's just not cost effective for Medicaid to go after the house. They have to have attorneys come in and do all the work, and it's just not worth it. So if it's just a low estate value of like $10,000 or less, or they're not going to get a lot of money, they'll drop the claim. But if there's a house involved, there's incentive there. But remember, too, that Medicaid, they are a probate creditor. They can only come after the house, quote unquote, in the probate process. They're like a hospital bill, a creditor, like a credit card bill. They come in line with everybody else, and they want to come through that process through probate. How do we avoid that? Avoid probate. How do we do that for your house? There's something called a ladybird deed or a transfer on death deed. I highly, highly, highly recommend everyone have this. Now, this might not work for everybody. So let's say you have 4 children and you're a single parent, and it's maybe not ideal to have all your 4 kids own a house together because they're going to be fighting, or maybe one can't afford property taxes, or whatever the situation may be. Sometimes transfer on death deeds are not the best option, but if you want to protect it from Medicaid, you're going to need to do this deed because it removes the home from probate. It transfers at death instantaneously. It's in a vested interest. So at that point, the home's now part of your your children's estate, and it's not part of your estate anymore. So what is Medicaid going to go after? There's nothing left. There's a car. They're not going to go after a car. That's not worth their time. So ladybird deeds and transfer on death deeds, they avoid probate in general, obviously. I have one on my house. So it's going to allow, if I pass away, my spouse is going to get the home, and then if we both pass away, our kids get the home. So now my kids aren't going to have to probate unless they want to or there's another need for it. So if you've got sort of a simple estate, they can really, really save your family money later having to pay for probate, because probate can run anywhere from $3,000 to $4,000 with a will. So, and if you don't have a will, you're talking probably 2 to 3 times as much. So highly recommend having a will, regardless of how small your estate is. I have seen families have to probate for one bank account. They had to pay me thousands of dollars to get to one bank account because they didn't have beneficiaries on that bank account, and it was a singular owned bank account. So it was unfortunate, but it was worth their time. There was a significant amount of money in there, so that's fine. But please consider doing an estate plan, or at least talking to some attorney. It doesn't have to be us. Please talk to somebody about checking your will, checking your powers of attorney, and seeing if this type of deed could really help your family, not only now, but for later, to save money in probate. Okay, so my biggest advice today, please don't wait until it's too late to update your financial power of attorney, because you do have to have capacity to execute a new power of attorney. If you have a dementia diagnosis, this does not mean that you are now ineligible to make your own legal documents. That's not the case at all. When you come see an elder law attorney especially, we understand capacity can ebb and flow depending on how you're feeling that day. UTIs for women, if women have a UTI and maybe it's undiagnosed, they can sort of exhibit those dementia symptoms, or it can be exacerbated. But please keep in mind that if you have capacity, when you meet with me and you understand the nature and consequences of what we're talking about, what you're signing, that's all I need. And as long as when you come back to sign with me, your capacity is still good, we can sign. It's okay if you have moments of incapacity or it's starting to wane, but it's always better to do it as early as possible, because remember, if you have children, other adult children who maybe don't want one particular child to be in charge, there might be an accusation of, oh, that power of attorney is invalid, oh, that will is invalid, and they might try to overturn that later or declare them void. So the earlier the better is the best news there. Okay, standard form online. You don't need an attorney to do a power of attorney. Okay, you can go online right now at the Health and Human Services, hhs.com, Advanced Directives. You can get your own power of attorney. Statutory durable power of attorney is your financial power of attorney. They also have a medical power of attorney and a directive to physician. You might know that as a living will. Here's the problem though. Those are the standard Texas forms. They don't have special language on them for unlimited gifting that we can really help families to protect those assets, to purchase annuities, to do a ladybird deed. They also don't have trust creation. So if we need to do that special trust for your income to help that family to qualify, we're stuck. So the standard form is awesome, but if you need Medicaid later, we might be in a pickle trying to protect your estate. So just keep that in mind. But you can go do that right now, get a notary. Mobile notaries can come to your house if you're disabled. You can get that done immediately, especially if you're in an immediate situation where you have a health crisis. Those can be very helpful. But I do recommend, especially for the financial power of attorney, you might want to have an elder law attorney at least look at what you have or do one for you if Medicaid's going to be in your future, simply because of these problems that we can run into. Springing versus immediate. Oh, another I wanted to point out, joint on accounts. What I mean by that is we had a client who was joint with her daughter on all of her accounts. And she insisted, I don't need a power of attorney. My daughter's on everything, we're fine. Later on, mom needs Medicaid, daughter comes back to us and is asking for help with qualifying for Medicaid. Oh dear, we have no powers of attorney. Well, what are we looking at for mom's estate? Oh no, we have a life insurance policy with $3,000 in there. Well, mom can't have more than $2,000 in assets to qualify. So daughter had to hire a guardianship attorney and go through a guardianship process through the courts to get guardianship over mom to sell that life insurance policy. All of that money just to take care of her mom to get her into Medicaid and nursing home. Had she just had a power of attorney, we would not have been in that pickle. But so it's just little things like that that you don't think about that you might run into later is good to start planning now. So springing versus immediate. So you'll have the option on your power of attorney to make it effective upon disability or incapacity. So a doctor declares incapacity, then it's effective. Or it's immediate, where it's just effective right after you sign it and have it notarized. I do not recommend a springing power of attorney. The odds of you finding a doctor who can sign off incapacity when you need it in an emergency or crisis situation might be small. So you don't want to be put in that position or have your family put in that position. So I recommend that it's effective immediately upon your signing. If you're a little uncomfortable about your loved one having access to that power of attorney right away, Just keep it safe. Keep it where you have control over it in your home. Please don't put it in your safe unless your loved ones have access to your safe. Please don't put it in your safety deposit box. That's like Fort Knox trying to get in there. If you have an emergency, the bank is just not going to have it. So make it to where it's safe but accessible. And trust creation, as I mentioned, it's good to have trust creation powers on your financial power of attorney so that your agent can go ahead and create that Miller Trust for you later. And unlimited gifting on the standard powers of attorney, it maxes out at the federal tax exclusion amount for gifting, which this year is only $19,000. I can't protect your estate very much with $19,000. I want to be able to protect your house, protect all your extra assets. So it's good to have that unlimited gifting on your power of attorney. So we have special language that also allows us to specifically create a ladybird deed. So in case you don't want to do that deed right now, you can actually give your agent the authority to do it later. So at that time, maybe when Medicaid does arise, then you could do the ladybird deed at that time. Protect it from Medicaid and protect it from probate. And also purchase the annuity. So if you need to purchase an annuity and protect $100,000 of your assets, I can't do much with a standard power of attorney. Per person. Yeah, so per person. So gifting, so if I'm a married couple, I can give 19 and my spouse can give 19, but so it's total per person 19. Okay, so can you receive Medicaid? Yes. Well, I have seen people do ladybird deeds on their own. I do not recommend it because there is very specific language that needs to be in that ladybird deed, and if you do it wrong, it could accidentally be a gift deed, which means you've gifted it right now, and then that person is now the official owner. Oops, I've seen that happen. You can also mess up the language where it's not effective, and so it's basically a void deed. So when the time comes, it's just not, it doesn't work. Yes, so it does vary state to state. So ladybird deeds are only allowed in 5 states. Texas is one of them. Most states do, I know, most people don't realize that. So ladybird deeds specifically. So there's a ladybird deed and there's a transfer on death deed. Most states do have a transfer on death deed. So I'll give you a little overview of the ladybird deed. It's a little bit different in how they work. So a transfer on death deed, you can add a contingent beneficiary. So for example, I want my spouse to go, I want my house to go to my spouse when I die and then to my kids. So that's a contingent beneficiary. The ladybird deed doesn't allow that. It's to that person or to 2 people equally. It's not to this person or to this person or then. Exactly, yes. So with a ladybird deed, you have to be very careful if you're married. There's been a lot of court cases on this. So whenever you have a married couple on a ladybird deed and they both are gifting, let's say to their child. Well, let's say husband dies. Well, husband's interest immediately vests to that child. So technically, you have the child owning half the house and mom owning half the house. Now, there's homestead protection laws in Texas, so the child can't force mom to leave or do anything with the house, but that could become a problem. Let's say mom wants to sell the house. Oops. Now you have to get consent from your child to do that. You want a mortgage, home equity loan, all of that, you would have to get consent from the other owner. So that is a problem. No, you would never put a minor on a deed. Oh, no. Yeah, if you have a minor, there's other ways to do that. You could do a deed to trust where you have like a homestead trust. Oh, I think we lost connection there. We lose power? Yes, I believe Florida's a state. I don't know all the states on top of my head. Oh, thank you. Nice. We lost power momentarily. We're back. Okay. So yes, ladybird deeds are awesome. One thing I do like about ladybird deeds is that the persons that you gift your home to, if that person predeceased you, that interest goes to their estate. So it's not lost, whoever their estate would be. Here's the problem. What if their will says their estate goes to their spouse? Do you want your daughter-in-law having your house? Maybe not. So a transfer on death deed might be good because a transfer on death deed says it goes to this person. If this person dies, it goes to the next person. So it allows a little more control. But there's a 2-year clawback period with transfer on death deeds. And under statute in Texas law, it says that creditors can pull that house back into probate if they so choose. I've never seen it done before, but it technically is allowed. Okay, so I'll finish up really quick. So if you want to receive Medicaid long-term care outside of the home, so let's say in the home or in a nursing facility or assisted living residence, there's something called the Star Plus Waiver Program, where you would have to qualify the same way we talked about today. All of the same elements apply. You actually do need that level of medical necessity, skilled nursing home care to qualify and have that care at home. But with all of these new changes coming about with Medicaid, this program is sort of up in the air of whether or not it's going to be sort of viable for clients to be able to access. Another thing that we found out recently is that Medicaid only pays their healthcare workers to come in around, I believe it's $11 an hour. Used to be, you would just sort of slip that person some money and supplement that money so that you can have that trusted person stay, even though they're not making very much with Medicaid. That's illegal to do now. It's actually a jailable offense. You can go to jail if you are supplementing your Medicaid healthcare worker that's coming in. So since you can no longer supplement, what is the incentive for these wonderful Medicare workers to stay working for Medicare if they could go work private pay and make 3 times as much? So the problem I'm seeing with clients, they cannot get someone to come in. They get qualified for Star Plus waiver, awesome, we're on it, we're ready, and then they can't get healthcare workers to come in, and they're stuck. So they end up having to move their loved one into a nursing community or nursing home. So it can be a problem, especially with all the new changes with Medicaid that are going to be coming later this year and next year. It's kind of up in the air. But just as an overview, you can do what's called consumer directive services. So you can, let's say you have your niece who you say, I'll move in, I'll take care of you. You can actually have your niece qualified as a Medicaid caregiver, and they can start getting money. Now, granted, it's their Medicaid pay rate, but they're going to be living there anyway, paying for you anyway, or taking care of you anyway. Why not get paid? So you can have them approved as a Medicaid caregiver. Spouses don't apply for that. It can only be friends, family members, things like that. Again, there's a same qualifications as a nursing home care applicant. Here's the problem with the Star Plus waiver program. You go on what's called an interest list. You call in, you give them your information, and then you wait. It can be months. I've had clients waiting years for the call, saying, okay, are you ready for Star Plus waiver? So if you're needing care right away, sometimes it's just not attainable to wait that long. So that's also something to consider. And again, the current status of this program is completely unknown. We don't know what's going to happen with it. We can still try, because obviously our goal is to have our loved ones stay at home. We don't want to have to go to the nursing home route. There's the day health centers that are here. There's other options. There's care homes. There's things that we can do to help your loved one get care and not go the nursing home route. But I just wanted to prepare this presentation so that y'all understand it's not unattainable to get Medicaid nursing home care. We can protect your assets. We can help your family to move those assets to your children if your powers of attorney allow it. There's things that we can do. And you don't have to be destitute to qualify. You can have a very sizable estate and still get nursing home Medicaid. So just keep that in mind. But if you have any questions, I have my personal email on here, apuckett@assisting-seniors.com. If you have questions for us, it's probably better that you call the office than emailing me, because I don't know how long it'll take me to get back to you. But I will do my very best. Since they're going to give you a copy of this presentation, if you want to call with questions, please feel free. Even if you don't need help with Medicaid, even if you have questions about, referrals for other attorneys, we're always able to help. Call our office. We're happy to do it. But anyway, I want to thank y'all for your time today and your attention. Thank you so much.
Thank you, Autumn. All right. Everyone, thank you so much for coming today, both our online and our in-person. Before anyone leaves, the Alzheimer's Association is here today. I wanted to invite Deidre with the Alzheimer's Association to come up very quickly to speak a little bit about them. And then again, don't leave yet and don't turn off your link yet, those of you that are online, because there's a little bit more information to share. Very quickly before Deidre comes up here, everyone, please give John and Autumn a round of applause for their wonderful presentations today. All right, Deirdre, I know I missed you a little bit earlier, so my apologies. It was a little bit crazy, but I opened everyone with a fun question. So my fun question for you is, what is your favorite thing to do on the weekends?
Besides just going to church, it's also about serving. And One of the things we're doing, we have a special relationship with Incarnate Word Sisters in Care. I won't talk about that one, but it's an awesome program. But I will tell you that we are doing a walk at our church on October the 11th. And a part of that is going to be a virtual dementia tour. So if no one has ever had the experience of knowing what it's like to have Alzheimer's, live with dementia, you can come and go through that experience with us. And you'll also have a chance to debrief. We won't give you that experience and then send you out the door. Someone will have a chance to talk to you. But I also want to mention that the Alzheimer's Association will also be doing their walk, the big walk, at Fiesta, Texas, on November the 8th, I believe it is. But we do have the literature at the table where you can stop by to talk, to see what's going on. Also want to share with you, at our table, we have a flyer. So if you need information about the Alzheimer's Association and the services we provide, the number is there. And we always tell you our services are free. You start with the 800 number, and then we have all these resources online that you can also take advantage of. One of the wonderful features is everything we do, besides being free, we offer the services in about 200 different languages. So language barriers should never be an issue. So I guess that's a little more than what I do on the weekends. I am a community volunteer with the association. I also sit on the board of directors for the association. So it is something near and dear to my heart. And I have had the personal experience of living with someone who had dementia. And a lot of people in the association have had that experience as well. So I thank you, Jennifer. I thank you all for the opportunity to talk about an organization that is near and dear to my heart. Thank you.
Thank you, Deirdre. Before you leave, I want to clarify very quickly and have you correct me. Even though it's called the Alzheimer's Association, the Alzheimer's provides resources for all different forms of dementia. Is that accurate?
Dementia is only an umbrella. And under that umbrella, you have Alzheimer's, which is the largest diagnostic group. But you also have vascular dementia, you have Lewy body dementia, and you do have other types of dementia. So it's called the Alzheimer's Association, but we do address. And our goal is to have a world without Alzheimer's or other dementias. So the money that's raised at the walk goes towards research. Most of the money from the association is not spent on administration. It is really spent on research so we can reach the goal. How was that?
That is perfect. Thank you so much, Deirdre. Okay, y'all, to learn more about the Alzheimer's Association, please don't forget you can Google them. You can find them on the Alzheimer's Association to find your local chapter. So again, thank you so much for joining us for this annual conference of the Alamo Caregiver Support Coalition. If you have any questions or even to watch for, different emails that are coming from us for next year's conference, the email address is SA for San Antonio, SA Caregiver Coalition @gmail.com. Thank you so much to ACOG and all of our other representatives. And then, very quickly, before you all leave and before you sign off online, also, if you want to join our email list or learn more about the different resources here in San Antonio, because our vendors are amazing. The sponsors here did great today, and we're so thankful for them. But there are even more. So you can find us, again, email us at sacaregivercoalition@gmail.com. Or if you are Facebook like me, I'm Gen X, older, not the younger ones. Facebook, I love it. You can find us at Alamo Caregiver Support. That is a private group. Ask to join. Brett or myself or Jill will get that request. All right, all of you that are here in person, thank you so much for coming. Please don't forget, we have bags of produce for each of you, 25-pound bags of produce made possible by the San Antonio Food Bank. Thank you, everyone.